call this meeting to order. Welcome to the meeting number 4 of the House of Commons Standing Committee on the Status of Women. To begin, I would like to thank all of the members for being here today. To ensure an orderly meeting, I would like to outline a few rules to follow. Occupational health and safety have requested that we limit our movement in the room and wear masks unless seated. So anyone who has their mask on right now is able to take their mask off if you wish. It's a little warm. Floor markings indicate the path of travel, which goes this way around the table. And so it goes around, you'll see, going counterclockwise. And individuals should respect physical distancing and remain 2 meters from one another, particularly when unmasked. I know for our committee that's very, very hard because we actually really do care about one another. So try to stay away from one another today. Seats and microphones have been placed in manners which respect physical distancing. Therefore, I'm asking that they remain in the same location throughout this meeting. To minimize health risks, you will note that a limited personnel have been limited to attend today. Staff have received a phone number where they can listen into the proceedings in real time. You will note that no paper documents have been distributed. All documents have been distributed electronically to members. Should you require a copy of a document, please advise the clerk of the committee by emailing her at fiwo@carl.gc.ca. Today, we're going to begin on the motion from Jag Sahota to begin a study today on the effects of COVID-19 on women. The motion reads as follows. Would you like Jag to read this, or do you want me to read it? Jag, do you have the motion, or I'll just read it? I'm going to pass it over to Jag to read your motion.
So I need retraining on these things now. So the motion reads as follows, that the committee commence a study of the impacts of the COVID-19 pandemic on women on Tuesday, July 7, 2020, for a total of 6 hours to begin an examination of A, how the COVID-19 pandemic has uniquely impacted women, B, what supports women need in preparation for a potential second wave of the COVID-19 pandemic, and C, to consider the specific challenges that women in Canada are facing, namely, 1, women's physical safety and security as it relates to evident increases in domestic violence, human trafficking, and overarching health-related concerns for vulnerable demographics such as seniors. Number 2, women's economic stability as it relates to the closure of workplaces across the country, reduced family income, and the inability for many women-owned and operated small businesses to conduct business as usual. And 3, social pressures or obstacles due to the COVID-19 pandemic, including caregiving for children, elderly parents, or other family members, and that as a part of the study, the Minister of Women and Gender Equality and the Minister of Employment, Workforce Development and Disability Inclusion, as well as other witnesses, appear before the committee on July 7, 2020 to discuss the government's response to COVID-19 and how it relates to women.
Thank you very much, Jag. Is there any discussion from that motion? Seeing no discussion, do we all agree to this motion? All of those in agreement? All those saying yay? Unanimous. All those, I should ask, all those saying nay? It's unanimous. Thank you very much. So beginning at 12:30, the committee will commence a study of the impacts of the COVID-19 pandemic on women for a total of 6 hours. We will hear from the ministers tomorrow from 10:30 a.m. till 12 p.m. Following the study, a report will be produced for consideration of the committee. If the committee agrees, we'll quickly discuss drafting instructions with the analysts before we adopt the study budget. Is it agreed to move into camera to have this discussion? All those in agreement? Fantastic. We will now move into camera. Thank you. And good morning to everyone. Welcome to the study of impacts of COVID-19 on women. Today we're meeting until 6 p.m. to receive the testimony on this important topic. We will begin with opening statements of 10 minutes of the witness, followed by the rounds of questions. During the questioning of witnesses, there will be 6 minutes for the first questioner of each party as follows. Round 1, Conservative Party, Liberal Party, Bloc Québécois, and New Democratic Party. And for the second round, we'll continue to work together on those. Conservative Party, 5 minutes. Liberal Party, 5 minutes. Conservative, that's for the next. I will ask the members to raise their hands to ask any questions if we're not able to get everything circulated appropriately. But we're going to start with our first panel, and I am very honored to welcome Megan Walker, from the Executive Director of the London Abused Women's Centre, as well as Marcy Hawrinack, Founder and President, Canadian Equality of Network. I'm going to pass the floor. Actually, we'll start off with Marcy. Marcy, you have the floor for 10 minutes.
Thank you. I'd like to first thank for the invitation and the opportunity to testify before you today regarding the impacts of COVID-19 on women, or as I like to reframe it, the intersectional gendered impacts of COVID-19. So to start, I'm sure we all agree that we live in a country that isn't equal and where gender inequality persists. And you can see this to be true by looking at the many barriers that women and other marginalized or underrepresented populations in the workplace experience, which I see every day in my work. And you can also see gender inequality in the lack of women in leadership, domestic violence rates in this country, by examining the ingrained biases and stereotypes that we all have and that we've all learned, and by looking at gendered sectors and their value or worth that society places on them. For instance, sectors heavily dominated by men are given greater value than those of women. Also, sectors dominated by women tend to still have male leadership. And also by looking at the persistent gender wage gap. You can pretty much examine any sector in Canada and find evidence of gender inequality. And this was our reality pre-COVID-19. We were also starting an economic slump pre-COVID-19, especially in Alberta, where I'm based. And as you typically see in economic downturns, violence against women increases, caregiving responsibilities to women increase, and many of those other gender inequality indicators skyrocket. Now, once COVID-19 hit, it accelerated and exacerbated all of these inequalities. Then the employment drop related to social distancing measures created a large impact on sectors with high female employment shares. The virus itself doesn't discriminate based on gender or sex, but it's the systems and sectors that we have created and designed that are discriminatory. And COVID-19 is the flashlight illuminating all of the cracks of inequalities in our system. The workers that are most affected by COVID-19 and those that we rely on to keep us safe and informed, and are by the very nature of their jobs at most risk of contracting COVID-19, are predominantly women. Our healthcare sector is dominated by women in Canada. Nurses are 92% women. Lab techs are 80% women. Respiratory therapists, which are very important during COVID-19, are 75% women. And home care workers and personal support workers, 90% women. So these workers at the front lines of fighting COVID-19 are all predominantly women. Now, this extends beyond the healthcare sector to other jobs on the front lines of COVID-19. Our grocery store workers are 84% women, food service industry, 72% women, and janitorial staff, 71% women. When we look at the nonprofit sector, that includes food banks, shelters, women's shelters, homelessness supports, supports for people living with disabilities, that sector is 75% women. That sector alone employs over 2 million Canadians, but also relies heavily on a volunteer workforce of over 13 million people, with the majority of those being unpaid, incredibly important unpaid labor that helps support our most vulnerable during COVID-19, and again, predominantly women. And this sector in particular has also been crippled by a lack of financial relief and having to delay or cancel fundraising activities. And then when we look at the health and nonprofit sectors that are predominantly women, also require PPE to do their work and to stay safe. And we've seen a drastic shortage in PPE that's designed to fit women's bodies. We know that the majority of PPE, even those deemed unisex, were designed with only the average male bodies in mind. So we're actually unable to adequately protect these women working on the front lines. Then the education system, which again is dominated by a female workforce. Teachers are 77% women. TAs and EAs are 96% women, have all been drastically affected by COVID-19. And then when we look at the closing of schools, resulting in predominantly women having to homeschool their children, having to become their own daycares, or caring for elderly parents, neighbors, or coworkers, while meticulously cleaning and sanitizing their homes now, in addition to the usual grocery shopping, organizing laundry, and then all of this is on top of working their usual day jobs. And we know this because 75% of women caregivers in Canada are also employed full-time. We know that women are more likely to work over 20 plus hours a week than men as a caregiver, and twice as likely to provide personal care. And these stats come pre-COVID-19. When we apply an intersectional lens, we also learn that racialized women have more caregiving responsibilities than white women. And or alternatively, COVID-19 has also resulted in women having to completely drop out of the workforce due to these heavy caregiving and schooling responsibilities. A study was recently conducted to verify this and found that the majority of women that were seriously considering quitting their jobs during this time due to this caregiving were single mothers, then racialized women, followed by Asian women, and then white women. We also know that in March alone, labor data revealed that women accounted for 2/3 of job losses, despite making up less than half of the workforce to begin with. And those that didn't lose their job lost 50% more work hours than men. Also in March, women between the age of 25 and 54 years, so that core sort of working group, lost more than twice the jobs than men in that same age group. And nearly half of this decrease was among women working in part-time, often low-paying jobs in the service or care industries. In other cases, it's been reported that women are choosing to exit the workforce. So between February and March, the number of core-aged women who were not in the Canadian labor market grew substantially by over 10%. But this isn't a choice to leave the workforce. It is a need because, for example, in heterosexual relationships, women are typically paid less than their male partners, expected to be more responsible for caregiving, and now someone has to do it and look after children and school them because they're all at home together. And the CERB program may help these women in the short term, but this unfortunately will also have longer term negative effects on their career and future earning power that needs to be considered. The pandemic has also resulted in heightened domestic violence. Shelters, support organizations like the YWCA, and organizations that provide informal support to survivors like CEGES in Calgary, as well as policing agencies, have all reported heightened domestic violence rates. And several of them mentioned that the rates were lower at the beginning of the pandemic due to strict social isolation, where women were trapped at home with their abusers, as an example. And then once restrictions started to loosen, the rates just skyrocketed. We also know that women are more likely to experience poverty and have lower incomes. And women work 2/3 of minimum wage jobs, putting them at increased risk of unemployment and living a greater risk at poverty. So all of these impacts that have been documented thus far contribute to greater gender inequality in Canada. So in order to mitigate these disproportionate impacts and to prepare for a second wave of COVID-19, we need to ensure that all of our decisions are made with an intersectional gender lens to ensure that we're not repeating these patterns of inequality and discrimination, and that we can begin to make incremental, lasting change for the betterment of everyone. I'm an advocate for Gender-Based Analysis Plus, or GBA Plus, and it's incredibly important to ensure that this lens is being applied to all COVID-19 response, management, and prevention decision making. So now is the time to double down on GBA Plus. A good GBA Plus analysis doesn't just examine sex and gender, but also includes race, ethnicity, culture, language, ability, age, sexual orientation, and other factors like geographic location. So GBA Plus informed government programs would then be more effective and tailored to specific regions in Canada to remove barriers that specific populations may experience. And the Canadian Human Rights Commission, the G7 Gender Equality Advisory Council, and the United Nations along with a multitude of gender equality stakeholders across Canada and the world, have been advocating for countries to take a feminist approach to COVID-19. If we don't double down and ensure that an intersectional feminist lens, like GBA+, is effectively applied to all of our decisions and interventions, then we will fail Canadians, and women will continue to bear the brunt of the pandemic. Thank you.
Thank you very much, Marcy. And now we're going to move it over to Megan Walker, the Director at London Abuse Women's Centre. Megan, you have the floor for 10 minutes.
Thank you so much, and good morning or afternoon, Madam Chair and members of the committee. The London Abused Women's Centre is a non-crisis, non-residential feminist agency that provides women and girls over the age of 12 who are victims of male violence with immediate access to long-term women-centered trauma-informed service. This includes women and girls who are abused in their intimate partnerships, trafficked or sexually exploited into the commercial sex trade, including pornography, sexually assaulted by strangers, acquaintances, or by a date, and or women and girls subjected to sexual harassment and torture. LOC also provides support and counseling to family members of women and girls who have been trafficked and sexually exploited, missing, or have disappeared. Many parents have traveled from cities across this country to London, Ontario, to meet with us at LOC to help us find their daughters. Without LOC support, more than 200 family members would continue every single day to check online ads to see if their daughters were still being advertised to provide violent sexual services to men. And they do this because they need to know whether their daughters are alive or dead. During the 2019-2020 fiscal year, LOC provided service to 8,100 women and girls, which was a 107% increase over previous year. COVID has significantly impacted the lives of women, girls, and all children. Women have been forced to isolate in their homes with their abusers. And imagine just for one moment how your lives would be impacted if you were forced to remain in your home, knowing you will be repeatedly assaulted, raped, tortured, debased, and maybe even killed. Now imagine your young children forced to witness or be exposed daily to the violence their mother is facing. Some of these children may be harmed as they attempt to help their mothers. Others may be murdered along with their mothers. Older children will sometimes gather the younger siblings and take them to their bedroom, where they will pull dresser drawers or chests in front of their bedroom doors to keep their dad away. During COVID, many agencies, including LOC, had to close its physical space and work from home, providing online groups and phone counseling. Women trapped in their homes who needed help couldn't call for phone counseling. They couldn't call for the police, and they couldn't run to a friend's home. Leaving their abuser under ideal circumstances is very, very difficult. During COVID, it was almost impossible. And if they themselves were able to find a way to leave, they wouldn't do so if it meant leaving their children behind. Most women in these situations live under constant threat of being killed or having their children killed. And if the police do arrive, thanks to the wonderful alertness and intervention of a neighbor who decides to take action, where will she take her? I'm so sorry. Are you there with me still?
You're good to go.
Okay, sorry about that. And if the police call, where will she take those children? The shelters are full and there is no place for women and children to go. So during COVID, we did connect with London Police Service because we identified having no place to go was a huge gap. Police need to have a place where they can take women and children immediately. So the London Abused Women's Centre, in collaboration with London Police Service, responded by developing a protocol where Locke secured safe hotel rooms so police could take women and their children immediately to a hotel. Locke negotiated with the hotels so police could just drop in there with women day or night, anytime. And Locke would respond by stepping in to provide food cards, clothing, diapers, and any other identified needs. We provided counseling and safety planning immediately, and we helped women get to shelters as spaces became open. We helped them find long-term housing. This was a huge upfront cost to the London Abused Women's Centre, but we were later supported by the United Way and recently waged to the Canadian Women's Foundation to cover those costs. It certainly was not a perfect solution, but it provided hope when sometimes it was hope that was missing. Aside from the last 2 weeks of April and the first 2 weeks of May following the femicide in Nova Scotia, when Locke's service demands increased by almost 50%, our overall service demands during COVID decreased by 18%, as did London Police Service. This was all attributed to the 9 weeks when we worked from home. Our physical office was closed to walk in and drop in clients, and we were not able to provide services to women and girls in youth or adult detention centers. Phone and Zoom groups were simply not accessible to women at home with their abusers. COVID kept women hostage in their homes with their abusers. How could women possibly reach out for service when they couldn't even go to the bathroom without asking for permission to do so? However, Locke's anti-trafficking program saw a 37% increase in service requests during COVID. Notwithstanding the federal government's decision to discontinue to fund our trafficking program, in the very middle of COVID, the London community sustained us by providing funding to keep our program open until July 31st. Had our community not provided funding to sustain that program temporarily, 650 trafficked and sexually exploited women and girls with whom we have provided long-term service to would have had no place to go except back to their traffickers, where they may have ended up in the morgue. That, of course, does not bode well for a government that prides itself as being feminist. The fact that the Trudeau government thought it was okay to eliminate funding to all anti-trafficking programs across Canada in the midst of a deadly pandemic is deeply concerning about this government's commitment to women and girls. We find it devastating and appalling. Trafficking and sexual exploitation did not suddenly disappear or slow down during COVID. It increased. Men who believe they have a right to pay to rape women and girls increased their demand for underage and young women and girls. Sex purchasers fuel the demand for young girls and women, and it is traffickers who are always at the ready to make sure they have the supply needed to meet this increased demand. COVID was no exception. Traffickers continued to traffic vulnerable young women and underage women from city to city, from hotel to hotel along the 400 series highway. There is, of course, no social distancing and no PPE in the sex trade. While those precautions are mandated for healthcare practitioners exposed to bodily fluids, that would be contrary to the very purpose of the sex industry, to allow men unfettered access to rape women and girls. Men pay more for unprotected sex, and they pay more for the money shot where they can ejaculate on a woman's face. Not only have I not heard any public health official or politician address this, we have heard that too many of them believe that the role of women is to satisfy men, their sexual fetishes and fantasies. With schools closed, with children at home and parents working from home, we saw an increase in online luring of children. Girls were pressured to strip and masturbate for traffickers. They were young and naive and thought the boy or man online was interested in her. She never expected to be videotaped in various stages of nudity and masturbation. The videos were uploaded to porn sites like Pornhub, which is operated by MindGeek in Montreal. Horrified and devastated parents called Lock for help in removing these videos. We have been attempting and working very hard to do so. But the reality is, once these videos are up, they are easily downloaded, and even when removed from porn sites, remain forever embedded in somebody's download file. It's important for you to know that the funding the Trudeau government eliminated for Lock's anti-trafficking program we served on behalf of the government, and it was eliminated, cost only $164,000 per year.
We only have a few seconds left, Megan.
Okay, thanks. I just want to say that we are living in extraordinarily difficult times for women and for girls. Governments give a lot of promises to vulnerable and marginalized populations, but their actions move at a snail's pace, if at all. We're asking that the government take their blinders off, invest in all Canadians, not just those with a voice and a means to make campaign donations. Thank you.
And thank you very much. We're now going to start with our round of questions. I'm going to pass the floor over to Raquel. Raquel, you have 6 minutes. Go ahead, Raquel.
Great. Thank you, Chair. And thank you to Ms. Walker and Ms. Hronek for being here today. Greatly appreciate your testimonies. I'm a member of Parliament from Manitoba, and we know that the COVID-19 pandemic has disproportionately impacted women, as you've both outlined. And in Manitoba, we're facing a quite dire situation. Ms. Hronek, as you mentioned, before the COVID-19 pandemic hit, we're facing some of the highest rates of domestic violence against women in the country. We have over 12,000 children, by my last count, in Child and Family Services, which is the most per capita in the world. And for those reasons and many others, that's why I've been advocating to the wage officials and minister that we get an office in Manitoba, which we don't currently have. And there's been a number of alarming other things that have popped up lately in the media. We had a report from Shared Health Manitoba that there were over 90 cases reported of sexual assault involving the date rape drug in 2018. And of course, we know that very few sexual assault cases are actually reported. So this is clearly a rampant issue in Manitoba. So I just say that to say I greatly appreciate the work you're both doing, and that we take this very seriously as members of Parliament. I wanted to speak to you first, Ms. Hronek, about the GBA Plus analysis work that you do. And I wanted to get your take on some of the programs the government has announced over the last number of months. We know they've acted very quickly to bring forward these programs. My concern is that we're not aware of any GBA Plus analysis that was put on some of these programs. And I was wondering if you can comment on the CECRA program, the Canada Emergency Rental Assist Program for commercial properties. I may have got the acronym wrong there, but where the government will pay 50%, the tenant 25%, and then the landlord would take a 25% cut specifically. We're seeing very little uptake of this program, and anecdotally, I'm hearing that women entrepreneurs are having a much more difficult time getting this program. And I'm just wondering if you've had any experience with that, and if you could elaborate what a GBA Plus analysis may have showed on this program had it been done.
Sure. Thank you very much for your question. And thank you for sharing those stats about Manitoba. And it's pretty similar out in Alberta as well. But in terms of the Canada Emergency Commercial Rental Assistance Program, I know that, and I've been in communication with a lot of different women's support organizations, and particularly organizations that work to advance female entrepreneurship in Canada. And I've seen and heard very similar things from female entrepreneurs across the country. I've heard from ones in Manitoba and Alberta and even in downtown Toronto. And what we know is that female entrepreneurs have many unique barriers that they experience, one of them being access to capital and financing. So women entrepreneurs already face an uphill battle in growing and scaling their businesses, and in having the necessary capital and the income to ride out pandemics like COVID-19. And then added to this situation, what I've heard is that the Canada Emergency Commercial Rent Assistance Program which I haven't seen quantitative data on yet, and I'd encourage the government to share that if you have it yet. But what I've heard from female entrepreneurs across the country is that this program has failed them in a way. So, for example, there's this entrepreneur in downtown Toronto named Callie, and she's an incredible entrepreneur who owns this amazing business that is a large-scale fitness company, but then also incorporates a coffee shop and also co-working spaces for other female entrepreneurs. And she almost had to close her doors for good. And the only thing that prevented her from having to shut down for good was that the public health restrictions had started to loosen. So she was able to slowly reopen and re-engage. But
thank you, Ms.
definitely
Hronek.
that program itself didn't help.
Okay, thank you very much. I'll go to Ms. Walker now. I have one question regarding some of the funding the government had announced to $75 million of targeted funding, much of it for human sex trafficking. And I know that Ms. Walker, your organization, the London Abuse Women's Centre, did not receive any of that funding in this round, but I do know that PACE in Vancouver, an organization that takes a different approach than your organization to, I suppose, legitimize sex work rather than combating human sex trafficking, which I know is the London Abuse Women's Centre's approach. I just want to get your 2 cents on how you feel about this government's approach to sex work versus human trafficking and the priorities they're putting forward therein.
Well, we would never call it sex work because we don't believe exploitation of women and girls is actually work. And what is really upsetting is that the government of Canada did not advise any of the organizations that were previously funded through MAPI that they would not be receiving the funding. In fact, it took us to continue to call repeatedly, and it was not until after our funding period ended that we were advised there would be no funding. The government has now taken an approach where instead of allocating funding equally across this country as it did at one time, it has issued a targeted proposal call to 9 organizations where each of them can apply for up to $750,000 per year for 4 years, and 3 of them will be chosen. So when you compare $750,000 a year for 4 years for 3 organizations to the work the London Abuse Women's Centre has done, which is nationally and internationally recognized, for a cost of $164,000, none of this makes sense.
Thank you, Ms. Walker. Thank you very much. And thank you to Ms. Hronek as well. Appreciate both of your comments. And I think my time is up, Chair or Vice Chair. I mean, I can keep going.
Some minutes more.
Yeah, it's done. Yeah. Thank you very much.
Next one. What's the next one? Okay. Goody.
Thank you, Chair. Ladies, thank you both for being here today and in these unprecedented times, and thank you most importantly for the work that you do for the Canadians that you're helping and the women and young girls and everyone that you're doing. You're doing phenomenal work, and thank you for that. Ms. Walker, I want to give you a shout out too, because I believe it was in one of the early days of the pandemic that we realized, or you realized and brought to the attention, that the human trafficking hotline had ceased to work. So thank you for bringing that to your attention. And it was interesting that you reached out on one day and thankfully the next day the Minister of Public Safety had it up and relaunched. And since the relaunch, it's received more than 340 contacts. So thank you for that. If it wasn't for that, those ladies and friends would have slipped through the cracks again. And Ms. Hronek, I believe is the pronunciation. I really loved your words when you said COVID is a flashlight, because we all know a lot of these issues have been on the go for so long, and COVID did put the flashlight on them. So what are we doing, and what can we do better to make sure that when the second wave comes that we've addressed it, but more importantly that we've made changes for the organizations and these women and children and young boys in the future going forward. So just a couple little points I want to bring up with you. Number one, the funding that was announced in 2015, it was known that it was going to expire in 2020. So, and we recognize the importance of human trafficking. And that's why the human trafficking strategy is going to be launching the end of this month, I believe. So that will be great. We know that we're investing $75 million across the government, and it's $10 million for wage, and applications from the wage funding for that will be opened shortly. And we know there's an urgency of action, and that's why we've been rolling out some of the things now. And we know that we need to address the gender-based violence in all its forms, and that's why we're supporting the National Action Plan with more than $200 million in additional investment. And we know that women are at the core of our first ever national housing strategy. It's our 10-year, $55 billion plan to give more Canadians a place to call home. And 30% of those investments are projects. They have to go to projects that benefit women and girls. On top of that, we've promised to create at least 7,000 shelter spaces by 2027, and we already hit that number long before the pandemic of COVID-19 hit. However, since the pandemic began, we've doubled down on funding for vulnerable women and their families. One of our first announcements was the $50 million for this group, including $30 million for shelters and sexual assault centres, $10 million for Indigenous shelters through Indigenous Services Canada, and a $10 million contingency fund for groups like the London Women's Abuse Centre, and to provide the essential non-shelter the non-shelter services to help so many women. Through Women's Shelters Canada, we provided more than $20 million to more than 420 women's shelters across Canada from coast to coast to coast. Through the Canadian Women's Foundation, we've provided more than $2 million to more than 90 sexual assault centres. We've worked with the province of Quebec to deliver funding there as well. We've provided that province with $6.46 million. And according to the most recent report, that has gone to over 120 women's shelters and 50 sexual assault centres in the province of Quebec. And as we speak, the contingency fund is flowing out the door via the Canadian Women's Foundation. So we don't know exactly how many organizations have received money from that so far, but we do, and we can confirm that one of the recipients was yours, Ms. Walker, the London Abused Women's Centre. And to touch on childcare for a minute, I just want to make sure, because again, in all the conversations, it's our women able to go back to work, and the childcare component of that is so important. And we're proud that we've signed the first ever multilateral agreement with the provinces and territories on early learning and childcare, because we understand that investing in the children means investing in our future. We've provided $7.5 billion between 2017 and 2028 to give the children the best possible start in life. And since 2017, we've created more than 40,000 childcare spots and providing kids who need it the most with quality, affordable, culturally appropriate childcare. We put a lot of money in the pockets of 9 out of 10 families with the Canadian Child Benefit, and we're currently in the process of renewing each of the bilateral agreements with the provinces and territorial partners, and we hope to announce those agreements soon. We all know as many segments that childcare is basically the responsibility of the province, but we're jumping in to help out there. But we know there's still quite a lot more to do, and we know it's important to recognize how far we've come, but between 2015 and 2019, our government increased funding to women's and gender equality seeking organizations from less than $20 million under the last year in 2014, under the Harper government, to more than $65 million a year since then. This year, through the Department of Women and Gender Equality, WAGE, and that department didn't exist before, it was instead a subsection of another department, our government has approved total funding of over $110 million. That's more than the combined total funding in the last 5 years of the Conservative government. So it's wonderful that this has come to the forefront, and thanks to our investments, we are providing essential funding to more than 1,200 organizations. Ms. Henerick, I'd be curious to hear from you as we talk about the COVID-19 issue. In your experiences in Alberta, where you hit the downturn of the oil and gas industry, which my province is going through that now too, what programs did you come up with that really helped? How can we learn from what you did in Alberta and your experiences there? What can we learn and glean from that as we take forward in what we're doing in COVID now and what we have to do in coming up in the second wave of COVID?
Time is over. Just 10 seconds, if quickly.
Hi there.
I thought I had 7 minutes, sorry.
Okay.
Okay, thank you for your question. we're still kind of in the thick of it in Alberta, and kind of in the emergency response phase. And I think it might be too soon to share anything that we did that's really, really good that could be replicated across the country, because Albertans are still really suffering, especially women. But I do have some more general recommendations that I think would be applicable across the country, and that's to ensure that collection of diversity and gender disaggregated data and everything. And I've communicated with emergency management agencies across the country, and what they've all shared to me is that they are not applying a GBA plus lens, and that they are not putting this intersectional lens on their work, because they feel like they're kind of in an emergency, and it kind of is the first thing that gets left out, which I think is unacceptable. And I'd love it for the federal government to take leadership and push or advocate for that, especially since GBA Plus should not be slowing down their work or their processes at all. And, you know, it's been around since 1995. It was reinvigorated, thank you very much, in 2016. And over the last few years, it should already be sort of seamlessly integrated into the way that the government does business. And I commend you for your investments in childcare. And I think a really targeted approach as well to fund emergency, accessible, and flexible childcare for everyone would be amazing. Also, even establishing permanent top-ups for professionals who work with people with disabilities or the elderly or those experiencing domestic violence and homelessness. And I think also anything we can do to disrupt and affect social norms that perpetuate inequality and do not advance gender equality, which could be some sort of campaign to disrupt these biases and social norms to prevent the burden being placed on women.
Thank you. And next speaker is Block.
Excuse me, Madam Chair. Your former speaker, Ms. Hutchings, mentioned the London Abused Women's Centre twice. And I just want to say that this opportunity for us to appear is important so that you can learn what's going
Ms.
on.
Ruckert, you can answer on the next question. Now, next term is Block. Go ahead.
I'm just concerned about political speeches on the floor when we are here to actually be consulted with.
Go ahead.
Merci beaucoup. Vraiment deux.
Thank you very much. Two very important discussions. I hope I'll have enough time to speak to both Megan and Marcy. Thank you to both of you. I'll start with Marcy. Your group provides interesting services, for example, training on gender-based analysis and so on. When we're talking about appropriate measures or measures that are appropriate or not regarding the pandemic, I was talking to a doctor who had a health clinic in her community. She talked to a lot of women who worked, for example, in health services or who were hairdressers, and the CRB was not accessible to them yet because often their businesses are very small, who don't have the money, or actually who just work through their personal account and don't have a business account, so they don't have access to that fund. Earlier, we talked about the commercial rent program. These programs aren't focused on women. Do we have other quick examples that are easy to mention regarding the GBA plus analysis measures that could be taken in this crisis?
Sure. Thank you so much for your question. And I'll build off of it a little bit in terms of the CERB program too. It could be it's partially good because it helps women earn some money while bearing this sort of caregiving load. But what it does is that the CERB program isn't advancing or supporting gender equality, which is the goal of GBA plus, and it makes it easier for families to burden women and makes it easier for women to exit the workforce. So post-COVID-19, it will be really important to pay attention to this and to help women re-enter the workforce and not face pay barriers or discrimination for taking this time off. And I've heard very similar things to what you mentioned also about how CRB is inaccessible to women-owned smaller businesses as well. Yeah, I hope that helps.
Je crois aussi que l'éducation.
I also believe
justement d'enrayer des enjeux sociaux importants comme le secteur.
Especially to fight against sexism, racism, and so on, other forms of discrimination. You're working on that with your group. There is training that is being provided and conferences that you hold also. What are the hardest prejudices to fight against in terms of public policy towards women? And does the work-life balance the cornerstone of the problem for women's participation in the public life? How can we work on that?
Thank you. I think maybe one of the hardest prejudices to fight to advance gender equality and to advance women is that there's a movement in Canada that believes that this isn't a problem or that gender equality exists, right? Or that they are misinformed with what gender equality really means. And they think that it means, same treatment, exactly the same. And that's not what the movement is about. So partially, I think, is providing that level of awareness and education on what the goal is and how it benefits everyone. But then also there's subtle biases that we all have, and sometimes it's referred to as unconscious biases. And we're seeing it being raised a lot with the Black Lives Matter movement with racism, but the same exists with sexism. And those are often subtle and harder to detect. But there's training that we do that can help you become bias aware. And there's specific processes similar to a GBA Plus process that you can adopt and integrate seamlessly into your daily work in order to disrupt those biases.
Oui, parce qu'on sait, elles ont beaucoup.
We know that there's a strong mental burden for women. You've talked about all the invisible work that women do. It's not recognized enough. We're talking about responsibilities and social involvement at home because they are doing more. They feel like they're helping their family. It's difficult to change things to do. How can we help women's participation, and what can the government do to help them?
Sure. I think the government can play a role also as a catalyst in achieving gender equality. I don't think government is necessarily the best vehicle for, doing all of that change. And there's, the government has limited scope too. But I think that the government can definitely lead by example. I like that there is a dedicated department wage. I think ensuring that they're adequately resourced is incredibly important. And they're very small. They're a very small department that's responsible kind of for pushing out GBA Plus to the entire federal government. And as you can see, GBA Plus isn't always being applied. So that's a big problem that I think should be addressed too, is they need more support and assistance. And also looking at regional differences across Canada and the status of women kind of in each different province and territory, and trying to enact targeted solutions to support women there. And one of the examples that I mentioned that I'd recommend is also trying to disrupt those social norms and anti-equality biases through even public awareness campaigns and public education and influencing people at a young age in early school curriculum as well.
Parfait. Est-ce que j'ai encore une autre minute?
Do I still have a minute? Can I ask another question?
Lindsay?
Thank you very much to the witnesses for both attending. Your testimony is extremely valuable, so thank you. I'd like to focus my time with Ms. Walker. You were very passionate and very clear in terms of the impacts on our local community due to COVID and some of the choices that have been made. The level of rhetoric that we heard, I would have expected for tomorrow, but we heard it today. I'd like to sort through some of that. Obviously, we know in London, human trafficking is a significant problem. Our proximity to the 401 and that major transportation route is a huge issue. The the funding that you had received before for the duration of the MAPI program, and now the gap that you're seeing in between the delivery of new programming through the public safety department. This is a huge gap, and I understand. I'm so grateful to the London community for coming to our community's aid to help stop this gap. However, could you talk a little bit about what, if you are successful in receiving continued funding, I'd like to hear about what problems this will cause in terms of having to stop the funding because you're all right until the end of July, but to restart a program that won't probably receive that funding until much later. What are the costs to restarting that problem? What gaps will you see? And in addition to that, if you could start to address, I know that there were some considerations that the funding that you had previously received versus the funding that you could potentially in the future receive either through public safety or through wage funding will be significantly less. So what are you looking at in terms of your that programming future with those gaps and with those smaller levels of funding in place?
Thank you very much. I first of all want to say that there are significant gaps, and I really have to question the integrity of any government that pulls funding to help trafficked women and girls in the middle of the largest pandemic anybody has ever experienced on this planet at this point. I want you to know that we are very lucky in London, Ontario, and Londoners are appalled by what this government has done. And in fact, we are routinely and regularly receiving phone calls from Londoners who are expressing their support for our program and what it does for our community in this country, and are willing to donate their dollars to us directly instead of donations to the coffers of the Trudeau government. I do want to say that there is another gap I'd like to mention here, which is that the London Abused Women's Centre has advocated strenuously since COVID started that some of the COVID funding announced each and every day go to women who are in prostitution, who are trafficked and exploited. They have no history of a job, so they do not qualify. And we've proposed a number of solutions, and yet still this most vulnerable population has received no funding to allow them to exit. And again, I find that devastating. As far as what are we going to do, the government has clearly turned its back on the women and girls we serve in London. It's betrayed those women and girls. We know London is a sex trafficking hub because of its access to the 401, but also its proximity between Detroit, where prostitution is prohibited, and Toronto. And our community is going to continue to come forward for us. And in fact, we will not allow that program to close. Justin Trudeau may stand as a feminist, but he will not take down feminist organizations with his short-sighted decisions as like the one he has just made. And so in the coming days, we will be making a large announcement supported by our community. And I can assure every single one of the 650 trafficked women and girls who continue to access our service on a daily basis will not be left behind by London.
Lindsay, you have about 20 seconds for answer and question, so that's good.
Okay. In terms of for both organizations, I suppose I've been trying to advocate for a return from short-term project funding to core, reliable, long-term, sustainable funding. So maybe really quickly, if you could talk about the importance of that for both the organizations.
And if you could
Can
make
I just say one? Yep. So one very quick thing is that the government's proposal right now is to fund $750,000 per year for 4 years to 3 organizations across Canada, with the commitment that they sustain that in the future. That is just unrealistic and will not happen.
Okay, and Marcy, if you could answer in about 10 to 15 seconds.
Sure. I did see. Yeah, sorry. I did see the announcement that also there's $350 million to the country's charity sector to help them But again, this isn't long-term, and what was actually recommended by the YWCA to be effective for that sector is $8 billion. So there's a big discrepancy there.
Well, this has finished. We're finishing up our first round of questions on our first panel today. We have all had the opportunity to go through this. And I would really like to thank from the bottom of my heart Marcy Haverneck, the founder and president of the Canadian Equality Network, as well as Megan Walker, executive director of London Abused Women's Centre. Thank you for joining us on this extremely important study. We are going to be suspending for half an hour, and then we'll be back. Thank you. We're suspending for half an hour, and thank you very much.
Thank you.
once everybody takes their seats, we'll get this started. Fantastic. I'd like to reconvene today's this afternoon's meeting study on impact of COVID-19 on women. Today we're going to start our second panel. We have three excellent people coming to this one. Anne Decter she's the Senior Director of the Canadian Women's Foundation. Morna Ballantyne, who is the Executive Director of Childcare Now. And Hélène Cornelier, Communications Manager, Association Féminine d'Éducation et d'Action Sociale. We are now going to pass the mic over, and you've got 10 minutes each. For each person, you will have 10 minutes. And so I'm going to pass the floor over to Anne Decter. You have the floor for 10 minutes. Currently, you are muted. So if you could, oh, there's Anne right there. Fantastic. Anne, you've got the floor.
Thank you. Good afternoon. I'm Anne Decter from the Canadian Women's Foundation, Canada's only national public foundation for women and girls, and one of the 10 largest foundations in the world. Through 3 decades, our granting work has focused on moving women out of poverty and violence and into safety and confidence. Thank you for the invitation to appear today on this urgent question. Urgent because women in Canada have been impacted by the pandemic to an extent that threatens to roll back equality gains. Women's safety, livelihoods, and well-being have all been put at risk, and most severely for women from communities that are marginalized by systemic discrimination. The pandemic has shone a penetrating light on gender-based violence, women's economic security, care work, and the central economic role of childcare. Economic losses have fallen heavily on women and most dramatically on women living on low incomes who experience intersecting inequalities based on race, disability, education, colonization, and migration and immigration status. A historic downturn in women's employment, compounded by uncertainty over the capacity of our fragile childcare sector to fully reopen, is a potential perfect storm for women's economic security. Women in diverse and marginalized communities can be expected to have the greatest difficulty emerging from this crisis. The scale of women's jobs losses is enormous. At the end of May, 1.5 million women had lost their jobs and another 1.2 million had lost the majority of their work hours, impacting more than 1/4 of all women workers. The lowest wage earners have been hit the hardest. 58% of women earning $14 per hour or less were laid off or lost most of their work by April. Overall, women earning the lowest 10% of wages experienced job loss at 50 times the rate of the highest wage earners. This is the type of granular data revealed by intersectional gender-based analysis that is needed to support decisions on next steps. Mothers are experiencing disproportionate job loss. They account for 57% of parents who had lost their jobs or most of their hours by the end of May, and only 41% of employment gains. More than 1/4 of mothers with children under 12 who were working in February were unemployed or working less than half-time by April's end. Mothers parenting on their own were more likely to lose work than those in 2-parent families. Women are leaving the labor market and increasing their care responsibilities at home. The number of women in core working years outside the labor market increased 34% February to the end of April. Women who stopped looking for work, that includes women who stopped looking for work due to soaring unemployment or to take up care responsibilities at home. This leaves women's economic security under threat. Access to childcare underpins mothers' access to the workforce, and without government intervention, childcare will be scarcer and more expensive. 1 out of 3 childcare centers have not confirmed they will reopen. Physical distancing requirements are reducing spaces. Personal protective equipment and sanitization will raise costs, increasing parent fees and putting childcare financially out of reach for more families. Parents of all genders need childcare to work, but for women who still shoulder a disproportionate share of family care work, it is essential. Emergency closure of childcare centers and schools placed a triple burden on mothers doing full-time jobs from home and managing both children and household tasks. Care work has been central to pandemic response. Our primary and long-term care systems are staffed largely by women. More than 1 in 3 women workers are in high-risk jobs with greater exposure to COVID-19. Women make up more than 2/3 of those who clean and disinfect buildings and almost 90% of personal support workers. After 2 decades of austerity in healthcare and community services, the most poorly paid workers, a highly racialized women majority workforce, form the first line of defense against catastrophic illness and economic depression. Canada's care economy is fractured, and women, largely racialized Black, migrant, and undocumented women, are bearing the brunt. Government withdrawal opened the door to proliferation of for-profit chains in care work, which reduce quality of care, staff levels, job benefits, and protections, with negative consequences for care recipients, the gendered racialized workforce, and Canada's pandemic response. Care work in Canada also has an entrenched reliance on highly skilled but low-paid migrant care workers who now fill positions in private homes and in healthcare facilities, yet face increasingly restricted chances of securing permanent residency and rights protections. Pandemic impacts on migrant care workers include dismissal by employers now working from home or laid off, 24/7 lockdown in employers' private homes, and loss of immigration status due to government processing delays. Stay-at-home orders increase risk of domestic violence and decreased women's ability to leave abusive homes for the safety of shelters, highlighting the importance of the violence prevention sector while placing additional strain on an already taxed anti-violence services. Closure of physical spaces and the shift to remote services created unique access barriers to sexual assault centers. In the best of times, gender-based violence services are underfunded and oversubscribed. Demand for access to women's shelters consistently exceeds capacity. Significant gaps persist in shelter services for women with disabilities and deaf women, women in rural and remote areas, and women in need of culturally specific services. 4 out of 5 women's shelters across the country are accessed by First Nation, Métis, or Inuit women, yet only 1 in 5 can frequently provide culturally appropriate programs. 70% of Inuit communities do not have access to a shelter. With the rise of Me Too, sexual assault centers experienced significant increases in calls without matching increases in funding. As the pandemic arrived, sexual assault survivors, some at high risk of suicide, were stuck on waiting lists for counseling across Canada. One sexual assault center executive director described transitioning to remote work. We had to invest in a phone system as ours was a donation from 1980. We didn't have funds for PPE for staff and volunteers accompanying women to hospitals, police, and doctors. As much as I'm grateful for the $25,000, I must be honest with you, it's not enough. We are running out of PPE, volunteers have begun to show signs of burnout, and we are averaging 60 to 80 crisis calls a day. As you are likely aware, the women's sector refers to nonprofits and charities that provide women-specific services and work to advance women's equality through policy, advocacy, and public engagement. That includes shelters for women, sexual assault centers, and women's centers providing a safety net to women and their families, essential to a healthy welfare state system and to achieving gender equality. The pandemic lockdown exposed and exacerbated existing flaws in the women's sector funding model. The sector is funded partially and irregularly through an unpredictable combination of individual donations, corporate gifts, and foundation and government grants. This is time-consuming and inefficient, requiring constant renewal and contact. Organizations constantly seek out, apply for, and renew funding that is largely project-based and temporary. Reports from the women's sector indicate an impending future crisis. Like the best of the pandemic emergency response from public health leaders, many of whom are women, recovery planning with women and gender equality in mind requires thorough analysis, clear evidence-supported outcome targets, a methodical approach to implementation, and responsible leadership with vision and heart. Should broad emergency measures need to be reimposed for another indefinite period, the Canadian Women's Foundation recommends the following actions with a reminder that an inclusive gender-based analysis with an intersectional lens is essential to design of all government recovery investments, short or long term. Women's economic security. Reinstate the Canada Emergency Response Benefit throughout any economic shutdown. Reinstate the Canada Emergency Wage Supplement with a simpler administrative mechanism throughout any economic shutdown. Broaden access to employment insurance so all women who pay in can access benefits. Work with the provinces and territories to implement 10 paid sick days as announced. Ensure funding is in place to safely reopen the childcare sector at pre-pandemic service levels and continue to expand until universal access is achieved. Women and care work. Work with the provinces and territories to immediately ensure that...
You're right at 10 minutes right now. We'll give you about 15 more seconds just to wrap it up, okay? Thank you.
Fine. That in long-term care facilities, staff work in a single facility in full-time jobs at a living wage with access to sick days, refusal of unsafe work, and appropriate protective equipment, care, and testing. Grant all migrant workers currently in Canada permanent residence.
Okay.
For the women's sector,
Anne,
I make 3.
Anne, hopefully we'll be able to get through there. Unfortunately, just because we have so short of time. Thank you so much. We're now going to pass it over to Morna Ballantyne with the Childcare Now. Morna, you have the floor.
Great. Thank you very much, Madam Chair and members of the committee, for inviting me to testify this afternoon. Childcare Now, also known as the Childcare Advocacy Association of Canada, was founded in 1982 to act on behalf of organizations and individuals who want high quality, affordable, and inclusive early learning and childcare to be available for all families and all children, regardless of where they live and regardless of their circumstances. We commend the Standing Committee on the Status of Women for undertaking an examination of the impact of COVID-19 on women and for recognizing that such an examination would be incomplete without addressing the impact of COVID-19 on women's access to childcare. I appeared before your committee 3 years ago when you were carrying out a study on the economic security of women. I and many other witnesses said then that women in Canada will not and cannot achieve economic security without full access to the paid labor force and to properly paid work. And this will not and cannot happen without a publicly funded and publicly managed childcare system. It's taken a public health crisis to prove our argument yet again. And now, finally, the essential and multiple roles of childcare are being recognized, including by our Prime Minister. COVID-19 also exposes the fragility of the provision of childcare in Canada. However, what governments will do about it, if anything, remains to be seen. Statistics Canada's Labour Force survey confirms the devastating impact of the pandemic on women's employment, and particularly on the employment of mothers with children under the age of 12. While the May jobs report shows some job recovery overall, women accounted for only 29% of that recovery. Getting women back into the paid labor force is critical to women's economic security, but increasing women's labor force participation is also crucial to a sustainable economic recovery for everyone. The construction of an accessible, affordable, quality, inclusive system of childcare is essential if Canada is to forge a resilient and a just future, and also become the best possible place for children. Childcare in Canada was fragile before the pandemic hit because it's market-based, it's fragmented, and seriously underfunded. Parents in Canada are forced to purchase services from a childcare market, some of which is regulated, much of it which is not, some of which is not for profit, and some a source of profit. It's a market that offers a confusing array of very scarce offerings, too many of which are poor quality, and almost all of which are unaffordable for most families. It contributes to and it exacerbates economic and social inequity. Indigenous families, racialized families, and low-income households are disproportionately shut out. The childcare market is also particularly bad at meeting the needs of children with disabilities, children whose parents work non-standard or irregular hours, or children who live in rural and remote communities. And this market approach works no better for childcare providers. Almost all programs outside of Quebec rely primarily on parent fee revenue to stay in operation. The predominantly female workforce earns low wages, and any raise in compensation translates into higher parent fees. Inadequate compensation has made the recruitment and the retention of qualified early childhood educators a perpetual serious concern. Leaving the provision of care to the market doesn't work for childcare any better than it would work for healthcare, primary education or secondary education, or countless other areas where governments have intervened for the benefit of all Canadians and because it makes economic sense to do so. COVID-19 exposed all the problems with market-based childcare and the absence of a fully publicly funded and publicly managed childcare system. When provinces and territories ordered childcare programs to close during the emergency response phase of the pandemic, with limited services for essential workers, this sector was disrupted in a way that it was not for public education or other parts of the public sector. The level of disruption depended on the approach taken by each province and territorial government. Where necessary support was provided, the childcare programs are in a much better position to reopen and respond to the needs of children and parents. But a survey of licensed childcare centers in Canada carried out in May found that more than 1/3 of the centers across Canada are uncertain about reopening. It's now time for major government intervention in early learning and childcare. Childcare Now has proposed a federal strategy for doing just that. Of course, we recognize that the reconstruction of childcare cannot be left to the federal government alone. It's going to require the federal government to work with the provinces, territories, and Indigenous governments and communities. But the federal government must provide policy leadership supported by its spending power to respond to the immediate economic and social fallout of COVID-19 and to set the foundation for longer-term system building. Our strategy calls for a two-phased approach. In the first phase, we want the federal government to spend $2.5 billion to support the safe and full recovery of regulated early learning and childcare, and to respond to the immediate care needs of school-age children. In the second phase, we propose that the federal government boost its childcare spending to $2 billion in 2021-22, and that this base be increased each year thereafter by $2 billion. These federal funds would be used to move Canada towards a fully publicly funded system in partnership with the provinces, territories, and Indigenous governments. 20% of this funding should be earmarked to support the Indigenous early learning and childcare framework. The federal government, under our plan, would require the provinces and territories to use the federal funds to achieve measurable improvements in accessibility, affordability, quality, and inclusiveness. Additionally, the federal government would establish and fund a federal early learning and childcare secretariat to lead and coordinate the federal government's work. Finally, the government would propose legislation that enshrines Canada's commitment to give all children the right to high-quality early learning and childcare. Let me elaborate very briefly on what we want to see in the first phase, which would start now and continue to the end of the current fiscal year. The federal government has promised $14 billion in new federal transfers to the provinces and territories to be rolled out over the remaining months of 2020. These transfers are to help finance the safe restart of the economy. What we propose is that the federal government allocate $2.5 billion of these promised transfers for spending on childcare. Agreements with each province and territory would ensure that the federal governments are used for 1, a safe restart of childcare programs, 2, the restoration and expansion of the number of licensed childcare spaces that existed prior to the pandemic. And 3, the establishment and operation of childcare programs for school-age children up to age 12 through the summer months and into the fall and winter. Parents need access to quality programs before and after school hours and or during regular school hours if schooling is not available because of public health concerns. Additionally, we want the federal funds to be used to improve the wages of those who work in early learning and childcare to ensure the return and retention of qualified staff to the sector. The federal secretariat that has been mandated by the Prime Minister of Canada would be established during this first phase. And its mandate would be to advise on, monitor, and evaluate phase 1 implementation and plan for phase 2, including the development of a comprehensive workforce and expansion strategies. Again, thanks for inviting me today. And I invite you to read the full text of our strategy, which is posted on our website at timeforchildcare.ca. And of course, I'm happy to answer any questions you have.
Thank you very much. I'm now going to pass the floor over to Hélène Cornelier, the Communications Manager Association for Féminine d'Éducation d'Action Sociale. You have the floor for 10 minutes. Thank you very much. So just to let you know, you are currently muted. Hélène, if you could unmute yourself so that we can start with your testimony.
Oui, ça va maintenant?
Wonderful.
Is that better? Great. So first, I'd like to thank you. I don't know if you missed that bit the first time. Thank you for your invitation to participate in your meeting today. The question in your mandate is directly related to one of the basic principles and issues for gender parity, and that is the recognition of the value of invisible work. It's under the specific angle that our organization is approaching this meeting today. Already in 1968, as part of the Byrd Commission, the Women's Association for Education and Social Action, called AFEAS, stated that it was important to recognize the invisible work or unpaid work done by women within the family and society. This role has also often been the social role for women, and it has made them poor throughout their lives. And we continue to work towards this, and nobody seemed to know that this kind of health crisis would happen. But since the very beginning, we have seen flagrant inequalities, especially for racialized and immigrant women. The pandemic has shone a light on the work of people who have been left in place to continue to ensure that society keeps working and that those who are sick can get care. 80% of workers are women in the healthcare sector, and caregivers are also especially women. It is mostly women who have been on the forefront and on the front lines from the beginning. However, women are excluded from decision-making, even if these decisions made on a daily basis are specifically related to them. In preparing for a second wave of the pandemic, reopening our economies, or any kind of new normal, the AFEAS is proposing some short-term and medium-term measures. In the short term, we are proposing 2 benchmarks to ensure that any policy, practice, or legislation ensure that women are included. We need to make sure that female MPs are involved, but also we need to involve women's organizations and associations who continue to work year after year for and with women. In order to be able to reopen after this crisis, we need to involve women. AFEAS is asking that the Government of Canada ensure that gender parity be required for all organizations put in place to manage this crisis, that it use the GBA Plus, Gender-Based Analysis Plus, to ensure that the needs and points of view of women are taken into account and heard. To truly recognize women's work to make all work visible. AFEAS is asking the federal government to institute a National Day of Invisible Work on the first Tuesday of every April, and especially to assess and integrate the economic value of unpaid work, what we call invisible work, to the GDP. So that you know, in 1992, Statistics Canada estimated that this work was equivalent to 34 to 54% of the GDP, representing between $235 and $374 billion. Now, in relation to some specific challenges facing women during this pandemic, we are proposing the following measures. In terms of health and safety of women, managing this crisis does create anxiety and stress for women who are managing things on a day-to-day basis, but also people for whom they are caregivers, for example, children and senior or disabled persons in their lives. For many women, even if they can access the CRB, losing their jobs adds an additional problem, and there is also domestic violence problems, and women and children are more greatly affected during these times of isolation. And the Government of Canada and provincial and local governments, in the case of confinement, must put in place services for children and seniors and others who need services, and ensure there's regular monitoring for people who are at risk, and also consolidate the shelter system for those who are victims of violence. In terms of the on the economic front, 120,000 women have lost their jobs compared to 555,100 men, and 2 times more women work part-time, and these are Quebec figures. Now, to give you a Canadian example, it would cost $4 to $10 billion to hire professionals to replace all of the invisible work that is done mostly by women. Only about 3.2% of caregivers, according to the Caregivers Association of Quebec, received tax breaks in 2017. Many caregivers cannot have access to various programs because of the eligibility criteria. Also, caregivers, on average, spend $7,600 per year to care for their loved ones, no matter their initial income. In order to support and promote the work of caregivers and others doing invisible work, AFEAS is asking the federal government to change the tax credits from non-reimbursable to reimbursable, to make changes to the employment insurance system by deleting or getting rid, of the 1-week waiting period and providing 35 weeks for each category, and also changing the definition of an adult child with serious illness to include chronic illnesses. In addition, AFEAS is asking for gender parity to be promoted across the government, and organizations under the federal government and those who wish to obtain contracts for them in terms of salary. Now, in terms of the social problems, we've seen from the other witnesses that the pandemic has made it necessary for seniors over 70 to be confined at home next students, young students, and then finally to close businesses. From one day to the next, people had to find ways to continue to do their jobs from home or through essential services while multitasking, trying to find health and safety measures, occupying children, finding care for people who need it without contaminating others and having to worry about all of that. Most of this work has fallen on the shoulders of women. To support women over the next several months, the Government of Canada and its provincial partners must put in place measures to ensure equal sharing of family responsibilities and tasks, consolidate family organizations and services, and come to agreements with employers to reduce productivity requirements, even when people are working from home, while maintaining the agreed upon weekly salary. In closing, to give you more ideas, the FS is asking for the federal government to develop a public network of daycares from one ocean to the other, to put in place a system of 10 days of paid leave, affordable housing, and that needs to be done quickly, and also social services at home that are complete and that are consistent with needs. And we urge the government to resist austerity measures once activities resume. This would only make people poorer and destroy the social services system, which is already fragile. We've already seen this happen. AFES, in closing, is also asking for specific attention to be paid to Indigenous communities on reserve and off reserve. If you're contagious, how can you self-isolate if your housing is overcrowded? How? Okay, in closing, how to respect health measures when clean water is not accessible. The decisions and needs assessment must take into account all the women who manage this. Thank you for listening to me.
We're going to start off with our rounds of questioning. We're going to start off with Jeg Sahota. Jeg, you have the floor for 6 minutes.
Thank you, ladies, for your time and your presentation. I have a few questions for Ms. Decter. The panel earlier today spoke to the deep need for added support for women facing abuse, particularly in the area of human trafficking and exploitation. Recently, the funding for the Measures to Address Prostitution initiative expired with no interim funding to help organizations continue their programming. We know that violence against women has increased during this pandemic and that trafficked women are now at an even greater risk than normal. In light of this, do you think the government should provide some kind of immediate interim support for these organizations? For Ms. Decter, yes.
That question, Ms. Decter? You may be on mute. So for Ms. Decker, you're probably on mute. So the Women's Foundation, can you hear us? Okay, so Anne, if you could just plug on mute. We're just checking up on this. She's still, we are trying to unmute you here, but you may be muted on your end. Should be
now
good.
I'm not muted on my
There
end.
you go,
Yes.
Anne. You've got, okay, fantastic. Go
It
right
wasn't
ahead.
me.
It's okay.
I'm sorry, I am not specifically informed on the trafficking programs, so I don't know exactly the situation there. I'd be happy to check with the women at the foundation who work on anti-trafficking work, but we would in general say yes, all anti-violence work is definitely in need of increased funding, as I was saying, it's basically over demand and underfunded, and it's a patchwork across the country of various provincial funding schemes. And I think that the pandemic has really shown that this needs to be a national system. We need a national action plan on violence against women and girls, and we also need the National Action Plan on Violence Against Indigenous women and girls to go ahead. These things need to come into place, well-funded as quickly as possible.
Okay. Thank you for that. Ms. Decter, sorry. We know that your organization distributed funding to sexual assault centers at the beginning of the pandemic. Can you outline the criteria that was used to determine which sexual assault centers were provided funding?
Anne, you're on mute again.
The host had remuted me. Sorry. The criteria were, again, I didn't work specifically on that, but they were developed working with the Department of Women and Gender Equality and the sexual assault centers that we forwarded government funding to. Were all outside of Quebec. We didn't work with any Quebec centers. They were all, that funding went straight through the Quebec government. And they also, we were, I guess, working with WAGE, again, not directly. I did do some phone calls to sexual assault centers and made sure that we had the correct registration information, but I wasn't involved at that level. But they also had to be not in receipt of funding that was going to women's shelters. So some organizations had both. And the goal there was to make sure that everybody got some money. So that's what I can tell you about the sexual assault centers funding. So that in that sense, they had to be, I believe they had to be non-residential programs, because the residential programs were considered to come under the rubric of shelters. But I would have to go back and check that for you if you like.
Would you be able to provide a copy of the criteria to the committee?
I think so. I will try and find it. I haven't seen it myself. I was just given a list to call.
Okay. Another question I have is, were any organizations that are not classified as sexual assault centers, such as YWCA or other multifunctional facilities, selected for funding?
I would have to check. So did multi-service organizations receive that funding?
Multifunctional facilities, like YWCAs.
Yeah, having worked for the YWCA for a decade, I think we call it a multi-service association.
Okay.
What the other criteria for sexual assault center? And did multi-service associations receive sexual assault center funding? That's specifically what you're asking?
Yes. You had organizations that would not, if they were not classified as sexual assault centers, did they receive funding?
Did they receive sexual assault center funding?
Yes.
Fantastic. Thank you very much. We're now going to pass it over to Sonia Sadu. Sonia, you have 6 minutes.
Thank you, Madam Chair. Thank you all. The work you're doing in your community, it's really appreciative. My question is to Ms. Anne Dexter. I just want to, I'm really just want to state that I'm really proud of the work the government has done to support women, including that GBA informs every department is like each department is responsible doing their own GBA analysis, which is a huge stride. I'm really proud of that. Now my question is to the response to COVID-19. The federal government created the Canada Emergency Response Benefit that has supported over 8 million Canadians who lost their job during COVID-19. More than 60% of early job losses were by women. In your opinion, how this program supported women facing many unique challenging during COVID-19. Can you explain that?
Well, I don't have data on the uptake of women who lost jobs, how many of them went on to the CERB, but I did think the CERB was very effective. I thought it was very smart to bring it up really quickly, and so that because it was not, we talk about a recession, but it wasn't so much a recession as an economic shutdown. So the underlying factors of the economy didn't cause people to lose jobs. What caused people to lose jobs was a choice we made on how to fight the pandemic. I have no problem with it. It was a smart choice. And so to continue for people to continue to have income through that period, I think was really, really important for those who were pushed out of work. As we know, the job losses for women, especially in the first month, were about two times the rate of men. And we also know that women are working more precariously. They have lower incomes. More of them are in part-time jobs and jobs with little or no benefits, sick leave, all those kinds of things. So to be able to move on to a benefit that exceeded the minimal amounts to get paid on EI, I think was probably very helpful.
Thank you. I have a meeting with some women organizations, and I heard that domestic violence is on the rise due to COVID-19. Your organization has launched a Signal for Help campaign to support women who are stuck with their abuser during COVID-19 and are finding it difficult to seek help. Could you explain how this campaign is working and how other organizations can make similar steps so they can help the other women in the community?
Sure. Well, the Signal for Help was actually brought to us by an advertising firm that wanted to do something to help out, and they had an idea that we could create some kind of a sign that people could use on a call like this, a woman could use on a call like this, that would indicate that she was in distress and didn't have a way. So they wanted to give an extra tool to a woman who was, trapped in a home and didn't have a way to communicate that or to leave. And so we worked with them to create a hand signal and called Signal for Help. I believe it starts like this, and then it goes like that. That indicates that I need help. We educated them around that telling people to call the police and send them over to the house was not necessarily the best steps. And so we worked through that process, and they created it in English, French, and Spanish, and have really pushed it out worldwide. We've seen people posting it from Brazil and different countries around the world. It doesn't obviously work for everyone, but a lot of people are at home and are working on calls like this. And if they're in a distressed situation and they get the signal, then the Signal for Help, the poster that moves around about it, says how to contact resources and steps that you can take to help out, rather than just calling the police right away in emergency. So it's free for anyone to use in any agency to adapt and forward as they want.
And the other question I want to ask, long-term care homes have been hit hard by COVID-19 across Canada. In my region, Peel, there's a lot of cases, like even though women's are hitting hard by COVID-19, what do you think, in your opinion, what any specific issue do women who work and reside in the LTC homes face during COVID-19, how we can protect that? We know a long-term care that comes under provincial jurisdictions, same as a child care. But how federal government can help there, and then how province can step up and then protect those, and what we need to what need to be done there?
Yeah. Well, I would say not an expert in long-term care by any stretch, but we do see really big differences in how some provinces have approached it and have had success compared to others. And one of the big factors is how much of it is privatized. Another factor is, and the privatization shapes the kind of jobs. So staff working in multiple care homes was really a problem. That's one of the, British Columbia kind of fared the best in Canada on long-term care. And they immediately stopped that back in March. And they also brought in pay to make sure everyone working the same position in a long-term care home was making the same amount of money. And I think those were really strong steps. I think the federal government can step into a leadership role in the same way that they are working to do in childcare, and work with all the provinces to bring their standards up. Canada actually has kind of the worst record on long-term care deaths in COVID in the developed world.
Excellent.
So we really missed the boat there.
Thank you.
Excellent. Thank you very much for that. We're now going to move it over, and we have Andriane, you have the floor.
Oui, merci beaucoup.
Thank you very much. So my questions will, I'll start with Ms. Cornely of the FAS. Thank you very much for being with us today. You proposed a number of solutions in your opening remarks, especially in terms of further recognizing the invisible work of women and providing remuneration. We know the work is not recognized enough. In particular, you said that payments through social services should be, or benefits rather, should be increased and so on. You gave us many solutions, many ideas for solutions to ensure that women are paid for the invisible work that they are done. And how does this invisible work impact on the quality of economic life for women?
Helene, you are muted, so if you could unmute Helene.
Voilà.
There she goes.
Oh, there we go. Well, effectively, I believe that the FAS, which is an organization that seeks to educate and go through social actions to achieve gender parity for women in Quebec, and we don't work directly with clients necessarily, so we have a fairly general file, but since we were created in 1966, we have focused on the unpaid work done by women, because since that period, women realized that women themselves and their daughters would stay poor all their lives if their work was not recognized and compensated and occasionally remunerated. You spoke about the RRQ measures that I spoke about. Actually, that I was not able to talk about since I didn't have enough time. But for the FAS, it's not enough to see years where women don't work because they're home with their children. That those years are simply removed from the number of years worked. That work has to be compensated by an average of the income earned by people who are working. So those years need to be compensated for, so that caregivers or mothers with their children are able to obtain some remuneration. There are so many instances where people need to leave the workforce, and that is to ensure that at retirement they can see their years of work reflected in what they get. And that's the kind of measures we're talking about. Tax credits are also what we're talking about, but when they're non-reimbursable, well, there are people who have a great pay. Those tax credits help them, but those who don't make a lot of money, those measures don't help them. Let's say people with $20,000 or more, well, people don't have access. Those people don't have access to that tax credit at all. So that needs to change so that caregivers who don't have an income can access that tax credit the same way those kinds of measures exist in Quebec. It's the same thing for caregivers. When we're looking at compassionate leave, I believe we're allowed 26 weeks, and then there's certain criteria around that. Now, those who use that benefit do have a 1-week waiting period. Caregivers may be splitting their time with somebody else. The second person taking care of whoever needs care does not have to that 1-week waiting period. So one person is always penalized. The measures we're proposing are necessary, essential, so that women can achieve parity. You will never see that gender parity without this kind of measure. And looking at income equality, I mean, that's a whole other topic that we could spend hours on. So to you, this would be very important. Okay, I don't have much time left, so I'll ask you a few questions one after the other. You talked about senior women. Do you believe there's a generational problem and that this generation is less autonomous than younger generations? We could talk also about helping women who are part of a health service, if this health service, this health sector was healthier, more fair, and to what extent will austerity measures impact that healthcare system, and what is the access of women to employment insurance and GBA Plus needs to be needs to be law to really make sure we can apply to each part of our recovery. Well, maybe I'll focus on the most important to our organization, GBA Plus, just like gender parity on all committees, are tools that already exist but will continue to be implemented in the recovery from this pandemic. That's essential. Otherwise, we'll never achieve parity. Women are doing more work than men. They've lost their jobs in many cases, or their jobs pay less than men's jobs. They will not be able to come out of this intact. And we need to think about all of the stress that is being generated by this situation, because they have to keep the household running, take care of those who need care, children, seniors.
We must pass it on to Lindsay. Lindsay, you have the floor for 6 minutes.
Thank you. So I think all of you touched on the fact that there is no recovery of Canada's economy without women, and they cannot recover without childcare. And I know that I hear from so many women in my community in London who, parents in general, that are overwhelmed by the high costs of that childcare. So I wanted to ask the witnesses if they could talk about the importance of that affordability piece of what the difference is between an idea of publicly funded childcare and how that differs from what we currently have in terms of the national childcare plan that the government has put forward. I'm also going to throw in there, in case I run out of time, the returning to Ms. Ballantyne's point on the establishment of legislation enshrining the right of high-quality childcare, affordable childcare into our system, what that would mean overall, and linking it to something like the Canada Health Act, where there's equality and accessibility across Canada.
That's for everybody. So I'm seeing that Helene is already on there. So Helene, if you'd like to begin by going through this, and then we'll go through that. Helene, you're there?
OK. Alors, je vais être...
Okay, I'll be brief because it's not something we focus on or one of our specializations, but what's essential for women, I believe, so that they can be at work, for men as well, is good quality childcare services, not the kinds of services where you just put children in a corner and they just play on their own. Educational services, that's what was created with the early childhood centers in Quebec, and we're asking in Quebec for the government to put more of those in place so that all women and families have access to them, and that's what we would want to see for Canadians as well. That also means that the government must fund these services so that families are faced with lower costs. Otherwise, they won't be able to partake in these services. There are some private daycares that are partly funded by the government, but the same criteria do not necessarily apply now. They should, in the same way as in the public network.
Perfect. Thank you. Can we hear from the other two as well, potentially?
Ann Decker, if you want to take the floor, and then we'll pass it over to Morna. So if we could make sure, fantastic.
Hi, sure. I'll just be quick because we endorse the work that Morna's organization does, and she's really the expert in this field. So I would just say in response, we do believe that all parents should have access to childcare, that it is key to women's economic security, independence, protection against violence. All of these things require access to childcare, that the rest of the country should have something similar to what Quebec has, low-cost, broad-based, affordable childcare. And at that point, I'll hand over to Morna on the details and consider us supportive of everything she says.
And Morna, you're being on, if we could have you start.
Thank you. Thanks. Yes. Just so you know, we don't have any control over our mute. So that's why it takes us a little while to speak and be heard. And I didn't hear you, the sound sort of went out and see when you spoke, but I think you specifically were asking what do we have now and what is the difference between what we have now and publicly funded childcare. So essentially what we have now is we don't have a system. What I tried to explain in my presentation is that essentially governments have handed over responsibility for childcare to the markets. The only exception is the province of Quebec. And that would be a long answer just to talk about Quebec, and Hélène spoke a little bit about that. But for most parents, responsibility for getting childcare rests with them. It doesn't rest with the government. And providing childcare also rests with individuals. So for the most part, the childcare that exists outside of Quebec exists because a bunch of people decided to provide it. They could be nonprofit organizations or they could be for-profit organizations, but it is not really a public system. And what we saw through COVID is that when you leave things to the market, something as essential as the safety and provision of care for children, then it ends up collapsing. A lot of parents, for example, have to turn to unregulated informal care, including relatives. That just fell apart through COVID. And so I think that's why it took COVID for everybody to understand we really have a problem here, because there really was nowhere to turn for the care of children. So what we think is that this health crisis creates a real opportunity for some rethinking to go on, and to stop relying on individual solutions for the provision of childcare and to look at collective solutions, and that means government solutions, because only government is actually in a place to properly fund the service, to organize the service, so that we don't end up in a situation where you might have childcare that's provided where it's not as needed, or in other places where we don't have it at all, what we call childcare deserts. So the only way to do that is for governments to step in. Yes, it's in the jurisdiction constitutionally of provinces and territories. However, the federal government, as we saw through COVID, when it wants to step in and get things done, it can do that. It just needs to do it. And the way it does it is by putting money on the table. And then saying to the provinces and the territories, let's sit down, we're willing to help you out with money, but let's also look at what makes sense. Let's draw on the evidence of what makes for a good program, and let's stop replicating mistakes, and let's start replicating success stories. And that's what we want to see.
Excellent. Thank you very much. And Lindsay, if you want to say thank you, you can. But on behalf, go ahead. On behalf of the committee, I would greatly like to thank Anne, Morna, and Hélène for taking part in today's panel. We're going to suspend, do a sound check for our next panel, and reconvene as soon as possible. Suspension. Okay. And welcome back, everybody. We are now on our third hour of today's study. On this, I would like to welcome Sarah Wolf, who is the Director of Indigenous Innovation Initiatives, Grand Challenges Canada, Vicki Saunders, who is the founder of SheEO, and Caitlin Geiger-Barjwich, Communications Development Manager, Women's Shelters of Canada. We're going to pass the floor over to Sarah. Sarah, you're going to have the floor for 10 minutes, and we'll pass it over to you now. Go ahead, Sarah.
Great, thank you. So Ani, bonjour, good afternoon, everyone. Madam Chair and committee members. My name is Sarah Wolf, and I am the Director of the Indigenous Innovation Initiative at Grand Challenges Canada. So thank you for inviting us to speak today on the gendered impacts of the COVID-19 pandemic in Canada. This is my first time addressing the Standing Committee, and I hope to be invited back again one day, and perhaps in person. I'd like to begin by acknowledging the long history and enduring presence of Indigenous peoples, including First Nations, Métis, and Inuit peoples across Turtle Island. As an Anishinaabe with strong connections to Brunswick House First Nation in Northern Ontario, I'd like to acknowledge. Oh.
We are able to hear you.
Sorry, I can hear two soundtracks speaking to me.
Okay, so we have two soundtracks.
I hear the introduction again.
Okay, just checking. Are you on the English channel, French channel? Are you on anything specific? I'm wondering if you're getting
on the English channel.
Okay, so you're not getting interpretation. Okay, or you're not hearing the interpretation too. So double check.
Yeah.
Can we just sound check that again? Can you just talk to me about the weather, Sarah? Tell me how you're doing.
Absolutely. It's a really hot day out here today.
Okay.
I'm still hearing recording.
You're still hearing recording?
Yeah, it's still playing in the background, and it's.
We are going to check on that. During this time, Sarah, I hate to do this to you. I'm going to have them check on that. But what I'm going to do is I'm going to flip to the next person. I will have them look at that individually. But I'm going to have Vicki Saunders take the floor now for the next 10 minutes, and Sarah will come back to you for those 10. Okay? So if we could have Vicki Saunders, from the founder of SheEO.
Hi, everyone. Thank you very much. I'm Vicki Saunders, founder of SheEO. Good afternoon. Bonjour. I started SheEO. I'm going to give just a quick overview about SheEO, how we're dealing with what's happening with COVID and the opportunity going forward afterwards. So for those of you who may not be familiar with our organization, we started in Canada 5 years ago, and we are a complete redoing of venture capital. If you were starting all over again and it was designed by women, it would look 100% different than it does the current way it is in the world right now. And so this is we designed and started this organization to solve the major challenge on the planet that 51% of the population gets 2.2% of the capital out there in the world. This is a global challenge, and it leaves us in a world that's designed mostly by men, for men, and there are just so many things missing from the existing world that we're living. Structures and systems are just so deeply biased, and that's not a future I want to live in. And so we're tackling this big challenge with SheEO. We are women who come together in a pretty unique way. We have this model of crowdfunding and crowdsourcing. So hundreds of women in each country come together. They contribute $1,100 as a gift. That money is pooled together and it's loaned out at 0% interest to women entrepreneurs who are working on the sustainable development goals with their businesses. So every business that we fund is majority woman-owned, woman-led, working on the SDGs, and has export potential with their business and revenue generating. So far we are in 5 countries with this model. We've exported it from Canada to the US, to New Zealand, Australia, and the UK, and we have 70 countries around the world that have reached out to replicate this model. We provide 0% interest loans to women entrepreneurs who pay it back over 5 years, and then we loan that money out again. So instead of the sort of economic model that we have in the world right now, where people invest to get a 10x big, huge return and hold on to that capital and accumulate it so that we have more and more inequality in the world, We have a model where women actually gift their capital forward, and then they bring all of their other capital, their social capital, their buying power, their networks, their expertise, their influence to help these businesses grow. And it's a pretty fun model to be part of. If you're an activator in our network, which is what we call you when you contribute capital, you vote for the ventures that you care about. So we have a 100% democratic selection process. We don't have some expert panel with all of the biases that come with some investment committee deciding on what's the hottest and latest. We have the intuition of hundreds of women deciding which ventures are creating incredible innovations to solve major challenges we're facing on. And then we get behind them with everything we've got to help them grow. And so this ecosystem-based approach has created unbelievable resilience in our network during COVID. We have not had a single business go down. We've funded 68 ventures. We have $5 million loaned out. We have a 97% payback rate. And as soon as COVID hit, one of the first things that we did was we gathered all of our ventures together globally, got them all on a call, and did a quick triage of red, yellow, and green. How are you doing? And we put our resources to the ones that were in the red bucket right away to help them. And so things like a venture in Calgary who hires homeless people to do laundry for restaurants all across the city and pays them a living wage. Amazing model called Common Good. 95% of their revenue was lost in the first day after the pandemic because all the restaurants closed. And so she got onto the call, a bucket of tears, I have to say. It was a really emotional moment, and just said, what am I going to do? Like, I can't actually lay off homeless people during this moment. It's terrible. And ventures in our network came together and said, what do you need? How much is your payroll for this month? And they loaned each other money so that she could get through and figure out how to pivot her business. We have story after story like that across our network of women coming together because we call this whole thing radical generosity. We are here to support each other. And that day, it was how do we make sure that no one loses jobs and no businesses go down? And so it's a community commitment that we've made to do this. So I'm probably a little bit of a good news story about what's going on here. Part of the challenge, however, is that, I've been thinking, I did a presentation to a standing committee of finance a few weeks ago. And I just found myself trying to find like, what is the simplest, I know you have a million things on your plate, and I'm so grateful that you're all in these rooms and not sleeping like the rest of the government officials that I know, that I think you've done an unbelievable job during COVID. If you just look at all the different possible things you can do, I would love to encourage everyone there today to please do whatever you can to solve this childcare nightmare that we continue to live in every single year. This is one of the easiest things to solve on the planet. If women and men were at the table when we designed our structures, we would have solved this right up front because it's not a hard thing to solve. But women who have children and are at home are in a world of pain. Women entrepreneurs are in a world of pain with this. What is happening during COVID is going to adversely affect women in so many different ways, from people having to decide, am I going to actually just keep my business going or take care of my kids? Like, how do you deal with these issues? And the demand for these services are massive. And so we've noticed that our ventures are really struggling with this, and with the number of the relief mechanisms that the government has put forth. For example, we have an amazing agricultural innovator out on the East Coast. She's able to get a wage subsidy to hire somebody or to keep someone on her staff. But what she really needs is to be able to use that money for childcare. And she's not allowed to do that. So she can hire someone to do the job that she wants to do, but she can't actually hire someone to do childcare. And so there's a lot of these biases sort of built into these relief structures because we don't value unpaid care. And we've monetized all of these different elements of our markets. So I think this is the one thing that I would love to really focus on. And I also, just on a go forward basis, would love to see more focus from the government perspective on innovation being outside the tech space. Because this process innovation that we've created with SheEO of not just using financial capital to create jobs and economic prosperity, but to actually bring all the other resources that we have in play, our influence and our networks and our expertise, leads to unbelievable outcomes. And so I just want to share very quickly, in the last year, we got women's entrepreneurship funding from Minister Ng's department. to help us get this model scaled. And in the last year, we created 276.4 jobs in Canada across our 27 ventures and through SheEO. And we got a $750 grant from the federal government. That is the equivalent of $2,164 per job that's being created. Like, I'd love to see anyone try and match that in what we're doing. Women are amazingly capital efficient, unbelievable. What we can do with a small amount of money is insane. So I think looking at other models and process innovations, as you're out there looking at new economic models, I hope that you'll pay attention to SheEO going forward. And I have a little deck that I'm going to forward after that's translated into French. Thank you very much.
Excellent, and thank you very much. Sarah Wolf, we're going to come back to you and let's try this again. Sarah, you have the floor for 10 minutes.
Thank you. I figured out what the problem was, so we should be good now. So again, I'm Sarah Wolf, and I'm the Director for the Indigenous Innovation Initiative at Grand Challenges Canada. So I do really want to thank you for inviting us to speak today on the gendered impacts of COVID-19 pandemic in Canada. This, like I said, is my first time addressing a standing committee, so I hope to get invited back again one day in person. Wanting to acknowledge the long history and enduring presence of Indigenous peoples, including First Nations, Métis, and Inuit peoples across Turtle Island. And as an Anishinaabe with strong connections to Brunswick House First Nation in Northern Ontario, I also want to acknowledge the territory of the Anishinaabe of Algonquin people of Cheboh-o-Badgewan, where I'm currently a visitor, and it's a very warm raspberry moon that we're experiencing right now. And the raspberry moon in the Anishinaabe teaching is the moon when great change begins. So I'm particularly looking forward to any questions you have regarding my statement. So for the last 10 years, Grand Challenges Canada has been dedicated to supporting bold ideas with big impact. We're funded by the Government of Canada and other partners, and we support innovators who are closest to some of the most pressing challenges in the world. The bold ideas that Grand Challenges Canada invests in integrate science and technology, as well as social and business, and also now Indigenous knowledge. And it's to save and improve lives for people in Canada and in low and middle income countries. Our organization has supported over 1,300 innovations in 106 countries. And we estimate that these innovations have the potential to save up to 1.8 million lives and improve up to 64 million lives by 2030. So we've been listening to our innovators, our partners, and our community members for the past 4 months to hear how COVID-19 has impacted their lives. Around the world, the pandemic is deepening pre-existing inequalities, particularly for poor and racialized people, and exposing vulnerabilities in social, political, and economic systems, which are in turn intensifying the impacts of the pandemic. We have disheartening evidence of even deeper impacts for those at the intersection of multiple vulnerabilities, like women living in poverty, and this is also emerging. An intersectional understanding then is what we need if we're to recover from COVID-19 in a good way in Canada and around the world. The United Nations policy brief on April 9th, titled The Impact of COVID-19 on Women, across every sphere, they noted from health to the economy and security to social protection, the impacts of COVID-19 are worsened for women and girls simply by virtue of their gender, increases in unpaid work we've already heard about, reallocation of resources, and even blunt attacks on sexual and reproductive health services, increases in gender-based violence, and the poorer you've started out, it's likely the worse it's gotten. And at home in Canada, we have the tendency to think that things are worse in the outside world, but the situation here for many is not actually much different. So today, as I appear before you, the committee, to discuss the gendered impacts of the pandemic on Indigenous peoples in Canada, I want to also talk about what the Indigenous Innovation Initiative is doing about it and how there is so much more that we could be doing. My sisters have historically experienced higher burdens of poverty, discrimination, criminalization, and violence. And there are a plethora of reports on the gendered impacts of being an Indigenous woman, girl, or gender diverse person in Canada, including the pivotal findings from the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls, Reclaiming Power and Place. The final report confirmed that domestic violence, human trafficking, and health-related concerns were already, among other things, significant issues for them, even before COVID-19. And I sincerely hope that everyone on the committee is already very familiar with the report and its corresponding calls for justice. The Indigenous communities awaiting the government's action plan on that. But there's also new reports that have recently surfaced about the gendered impacts of COVID-19 for Indigenous peoples. Last month, the Native Women's Association of Canada published an online survey of 750 Indigenous women and gender diverse people. And they noted a deeply concerning spike in the number of Indigenous women facing violence during this time of shelter in place, with almost 1 in 5 reporting a violent incident in the past 3 months. In fact, of the Indigenous women surveyed, more were concerned about violence than about the virus itself. And another key finding was that the financial impacts of COVID-19 are strongly correlated to violence against Indigenous women. Also in June, Pam Palmatier, chair in Indigenous governance at Ryerson University, wrote an article titled Gendered Pandemic Response Needed to Addressing Specific Needs of Indigenous Women, where she wrote, Canada's failure to use a gender lens on its pandemic measures ignores the many ways in which the COVID-19 pandemic is disproportionately impacting women in general, but now consider the dual disadvantage of Indigenous women who are also forced to navigate in an infrastructure of violence. And the article goes on to give evidence of the several ways Indigenous women and gender diverse people have been disproportionately impacted and where there's an urgent need for dedicated pandemic planning for this demographic. In a previous life, I worked as a midwife with urban Indigenous families, and that was, for about two decades. And my friends and former healthcare colleagues are reporting that at the street level, the impacts of opioid overdoses, untreated sexually transmitted infections, assaults, trafficking, street work, homelessness, mental health, unplanned pregnancies, they're all increasing, and in particularly for Indigenous people. So to maintain the status quo means that the gaps will continue to widen and that Indigenous women, girls, and gender diverse people will continue to fall deeper, but it doesn't have to be this way. The root cause of the gendered and racialized pandemic inequities that we're seeing are ingrained much deeper than extra masks and hand sanitizer. We need attention to be focused on creating sustainable long-term solutions. And this is an opportunity for Canada to commit to a gendered response, and one that includes a specifically tailored approach for Indigenous women and gender diverse people and their needs, and which takes into account the context of racialized violence and poverty. So small and medium sized enterprises play a key role in the Canadian economy, as we all know. Women, Indigenous and non-Indigenous, are also the foundation of families and communities. Between 2013 and 2017, small and medium-sized enterprises made up 85% of the net job creation in the private sector. And in 2017, small and medium-sized enterprises employed almost 90% of the private sector workforce in Canada, but only 1.4% were Indigenous owned, despite being 5% of the national population. And only 25% of that 1.4% was majority Indigenous women owned. There's a lot of work to do. So for Indigenous women and gender diverse people, economic reconciliation, it's critical to their emergence. And that will require sustainable investments in dedicated economic recovery efforts. Imagine what would happen if, as part of COVID-19 economic recovery plan, we invested in Indigenous women and gender diverse individuals so that they could position themselves to thrive when the Canadian and global economies reemerge. Seated with $10 million in matching funds from the Government of Canada's Department of Women and Gender Equality, we've already started this work at Grand Challenges Canada. we were overwhelmed by the results of our recent call for proposals to accelerate gender equality through Indigenous innovation and social entrepreneurship. We received 238 applications across business, health, social, tech, environmental, and cultural innovation. Unfortunately, we will only be able to fund the top 3% in this round, about 5 to 7 projects.
Pensez à l'impact éventuel.
Here, but think about the impact for Indigenous women and girls once the best ones are operational. Think about what the potential impact for Indigenous women and girls could be if we were able to fund even, say, the top 10%. And what if we invested even more in Indigenous innovation using a gender lens to give them and the next generation, because this is, after all, helping them to also take care of their families, an even better chance to reach their fullest potential? What if we started off by offsetting emergency relief funds and longer-term unemployment expenses for Indigenous folks who've lost their jobs because of the falling economy? I happen to know a group of Indigenous innovators that have some awesome ideas, lots of support from their communities, and tons of grit. It's crucial that any COVID-19 recovery plan globally and within Canada places women, girls, and gender diverse individuals, their inclusion, their representation, their rights, social and economic outcomes, equality and protection at the center if it's to have the necessary impact. But this recovery plan, it's also an opportunity to invest in equality from a gender and an anti-oppression lens. So let's give the world more of what Canada and all of us aspire to, where everyone has the opportunity to reach their fullest potential. Miigwech. Thank you. Merci.
Excellent, and thank you very much, Sarah. We're now going to move over to Caitlin Geiger-Bardswich, who is with the Women's Shelter Canada. You have the floor for 10 minutes, Caitlin.
Good afternoon, and thank you for this invitation. My name is Caitlin Geiger-Bardswich, and I am the Communications and Development Manager at Women's Shelters Canada, or WSC. WSC is a national organization representing the over 550 shelters and transition houses serving women and children affected by violence against women and intimate partner violence. We were created by the provincial and territorial shelter associations who wanted a voice on the national stage. Today, these 14 associations are our full members and make up our advisory council. During the height of the COVID-19 pandemic, we held weekly Zoom meetings with our advisory council, both to support them in learning from each other's contexts and to provide us with a sense of what was happening across the country. These remarks are informed by their experiences. I would like to begin by prefacing that while WSC's overall goal is to see an end to all violence against women, my remarks will focus on domestic violence, which includes family violence and intimate partner violence. I'm sure you will hear from other witnesses who will speak to other effects the COVID-19 pandemic has had on women, such as limits to reproductive choices and freedom, disproportionate job loss and increased childcare, and police violence against Indigenous and racialized people. Before the COVID pandemic arrived in Canada, things were already bleak for women fleeing violence. In fact, many have called violence against women, or VAW, the pandemic within the pandemic. The stats are indicative. Every 6 days, a woman is killed by her current or former intimate partner. Indigenous women are 2.7 times more likely to be victims of violence than non-Indigenous women. However, femicide rates for Indigenous women are 6 times higher than non-Indigenous women. We also know that certain groups such as women aged 15 to 24, racialized women, women living with disabilities, and LGBTQ+ people experience violence at disproportionate rates. During COVID-19, this violence did not stop. In fact, it increased. Across the country, there have been reports of 20 to 30% increases in rates of domestic violence. Police in some areas have also noted an increase in domestic violence calls. In Ontario, the Assaulted Women's Helpline, a 24/7 crisis counseling service, has seen a total increase of only 5% in the number of calls it received, but now has 4 times as many of those calls relating to women seeking shelter. Several shelters told us that it was not just the number of calls that increased, but the severity of the abuse they were seeing. Women's Shelters Canada's website, sheltersafe.ca, is an online clickable map for women or friends and family to find their closest shelter and its 24/7 crisis number. In April 2020, visits to ShelterSafe were double what they were in March 2020 and compared to April 2019. Our May 2020 visits were triple what they were in May 2019. We have also heard from shelters across the country that they are receiving more calls from family and friends trying to help their loved ones. On the other hand, there have also been regions such as the Northwest Territories, PEI, Indigenous communities in Manitoba, and other rural and northern areas where calls have been greatly reduced. We heard from some shelters that their phones were silent, their buildings nearly empty. This was perhaps even more terrifying than an increase in reported domestic violence because it meant that women hunkering down at home as was recommended were potentially trapped with their abusers and unable to call for help. Anecdotally, we heard from our members that abusers were using the COVID-19 pandemic as another tool in their toolbox. Some shelters spoke of women calling them from inside a locked bathroom, saying they only had a few minutes to speak. Others noted that abusers told their partners that they would get COVID if they left the house or threatened to tell their family and friends that they had COVID. Various factors associated with COVID-19 likely influenced the heightened rates of violence against women. Various studies have shown that stress, job loss, alcohol intake, and mental health issues can all exacerbate violence. However, we want to stress that COVID-19 does not turn people into abusers. While the pandemic can aggravate stress and violence, we cannot blame the violence we've seen during COVID on the pandemic itself. At times, the measures imposed by different levels of government had unintended consequences. Social isolation is an abuser's dream. Now that this isolation was government sanctioned, the situation for women living in violence worsened. Border closures also caused problems for some women. We heard of one woman who was fleeing her abuser in Alberta and tried to cross the Alberta-NWT border to stay with her mother in Yellowknife. She was refused entry into the territory and told to, quote, go find a shelter in Alberta. Too often, domestic violence can lead to domestic homicide or femicide. In the first month of pandemic-related lockdowns in Canada, at least 9 women and girls were killed in suspected domestic homicides. This does not include the Nova Scotia shootings that occurred in mid-April, where 9 men and 13 women were killed in a rampage that started with the perpetrator attacking his female partner in a case of domestic violence. For women's shelters across the country, COVID-19 highlighted something we at Women's Shelters Canada have been saying for the last few years, that the services a woman can access when she's fleeing violence should not depend on her postal code. During the pandemic, we asked our member shelter associations what was happening in their province and territory in relation to 5 questions, and this was updated at the end of June. First question was, are the VAW shelters or transition houses in your province or territory receiving provincial or territorial funds specifically for COVID-19? 7 answered no, 2 answered yes, and 3 said it was complicated. For example, that some but not all shelters were receiving funds. Number 2, is your provincial or territorial government ensuring shelters have PPE and EPA standard cleaner? 4 said no, 2 yes, and 6 said it's complicated. Number 3, are VAW shelters considered an essential service in your province or territory? 2 said no, 6 said yes, and 4 said it's complicated. Number 4, in your province territory, are VAW shelters receiving priority access for COVID testing? 5 said no, including PEI, which said it wasn't needed. 2 said yes, and 5 said it was complicated. And number 5, has your premier or provincial or territorial government made a public statement about not staying home if home is not safe? 3 said no, 5 said yes, and 4 said it was complicated. While the federal government normally only funds on-reserve shelters, the rest are funded provincially or territorially, it did allocate $26 million for VAW shelters and transition houses across the country due to COVID. The Department of Women and Gender Equality asked Women's Shelters Canada to distribute $20.5 million of these funds, which we agreed to do, knowing how important it was for shelters to receive these funds quickly. COVID-19 emergency funds were distributed to over 400 shelters across the country. However, those in Quebec waited weeks, if not months longer, to receive their funds distributed by their provincial government. We have also heard from several shelters expressing concern over eventual clawbacks from their operational funds from their provincial government because they received these federal emergency COVID funds. It wasn't all bad, of course. WSC personally saw an uptick in donations from individuals and organizations. We received our largest ever gift from the Rogers family last month. People were reaching out to us constantly by email and on social media to find out how they could help shelters across the country. We saw an increased number of stories in the press focused on domestic violence and the pandemic, and we were also pleased to see the federal government's commitment to build 10 new shelters on reserve and 2 in the territories. We have hope that this issue is now firmly on the agenda for both governments and individuals across the country. Now, on to recommendations for a potential second wave of COVID. We have 5. Number 1 is that shelters need more core funding. Before the pandemic, shelters were already grossly underfunded. Our More Than a Bed study published last year showed that 56% of shelters indicated that they could not meet their operating expenses without fundraising, while 11% said they could not meet their operational expenses even with fundraising. While the $26 million given by the federal government was badly needed and gratefully accepted, it is a drop in the bucket. We also echo Powtutit Inuit Women of Canada's call on the federal government to provide $20 million in its next budget for transitional housing and shelters in Inuit Nanangat and Ottawa for Inuit women and children fleeing violence. Number 2, all levels of government must stress the message to stay home only if home is safe. Our sector worked diligently during the pandemic using social media, traditional advertising, and countless media interviews to get the message out there that shelters were open and available and that women did not need to stay home if home was not safe. In a second wave, all levels of government need to relay this message. Number 3, Canada needs to look to promising practices from around the world when it comes to domestic violence and COVID-19. For example, in Tunisia, there was a quarantine center for women escaping domestic violence. In India, police checked up on women who had previously filed reports of domestic violence before the lockdown. In France, 20,000 hotel rooms were made available for survivors of domestic violence, and New Zealand included domestic violence preparations in its lockdown planning from the start. Number 4, the process of designing and implementing a multi-year national action plan on violence against women and gender-based violence must begin. We have been advocating for this for over 5 years with a coalition of organizations across the country. As you've heard, the situation of women fleeing violence and VAW shelters across the country during the pandemic differed according to where they were located. We are pleased with the current government's commitment to a national action plan and strongly urge that its development begins without delay. This plan needs to be robust and well-resourced, and I say I'm almost done, so I'm going to say quickly, number 5 is that we stand also with a national action plan and recommendations of the National Inquiry into Missing and Murdered Indigenous Women and Girls and implementing a national action plan in response to that. Thank you.
Excellent. Thank you so much, Caitlin. We're now going to start off with our rounds of questioning. We're going to start off with our 6 minutes and put to Nellie Shen. Nellie, you have the floor.
Thank you. Thank you so much. Am I on? I'd like to first begin by thanking all the witnesses today for sharing your heart and a concern that is actually fundamental to the wellness of our whole nation, because wellness begins at home. And of course, women being mothers and the nurturers in many cases, and having way more dynamic capacity and potential. I'm very happy to hear all the recommendations and insights you provided today. I wanted to direct my question first to regarding the to you actually, Caitlin, regarding domestic violence. I understand that when you said it's a pandemic within a pandemic, it's something that has always been with us, but I think we are in a time now, because it has come to our public attention in a certain way, that we can do more with it. I'm happy to hear that there are initiatives that the government has been making to start dealing with this. What do you feel is a core root problem that every tier of government, but since we are in the federal level, that we can do to mitigate some of the core root issues of why domestic violence happens?
So I think it's a very good question. I mean, I think every level of government needs to fund and give core funding to shelters, because there's going to be abuse against women no matter what happens, and we need shelters to be able to support those women. But we also need to try to prevent the violence. And I think that's where we need more perpetrator programs. We need more education starting from kids or when they're 4 years old. We also need to sort of hold accountable people when they say things that are victim blaming, or that in some ways are saying that a woman deserves violence, or that violence is not as severe as what women might say.
Thank you. We could probably expand on all of those things, but I know we're limited for time, so I'll move on to the next question, and that is, we don't know if there's going to be a second wave. It's very possible. So I'm very happy to hear the recommendations you made to be able to streamline some of our intervention before that happens. What are some ways that we could, as you were talking about prevention, how can we prevent in the window that we might possibly have? Hopefully there won't be a second wave, but in case there is, with all the complications of social distancing, and even the idea of counseling through Zoom or phone calls, it takes away from that human presence that counseling offers when you're one-on-one in a room having a conversation that's part of the healing. How can things be done differently between now and a potential second wave to create a more a conducive environment for things to be resolved and dealt with, and to prevent that rise of tension that happens in social isolation in families, homes, and exit strategies, police intervention? How can we as federals assist with that before the next wave, if it happens?
Is that to me as well?
Yes.
Caitlin? Yes?
Yes.
Okay. So from a shelter perspective, I think it would be very important to have priority COVID-19 testing. Something we saw is that women, when they were able to make the call to a shelter to leave a violent situation, they had to go into 2 weeks isolation within the shelter, which is very hard for a woman who is coming out of a violent situation and then has to be put into isolation. If their COVID testing was a priority, they might only have to do that for a few days. So that's something that we would definitely recommend. Also, in terms of prevention, I mean, we were, for sheltersafe.ca, our website, we did institute an update of that to show email addresses as well as text messaging and web chat services that were available, because sometimes those were more secure ways that women could reach out to shelters. I think it has to also come down to, having a living wage, looking at issues of poverty and racism, and all of these things that might exacerbate violence that I listed, such as, stress and job loss and all of that. If we look at those issues, those societal economic issues, that will also help with that stress as well.
Great. Do I have time for one more question? Okay. So I'm sorry, there's only a minute left. This is for Sarah regarding First Nations, Indigenous women. What can we do better in mitigating this cycle, the cycle of violence and oppression and abuse that women in that community encounter? Just similarly, the same question I asked Caitlin, what is a core root problem that we can start taking care of, COVID and beyond COVID?
Yeah, I mean, I think that it's what Caitlin said. I mean, there's multiple layers and everything's interconnected, but if we can build on women's economic resiliency and give them the tools to empower them to be self-sustaining, then they will be able to support themselves and their families. And that will mitigate quite a number of people who are just dependent on, shelter in place with their abusers, if they have the means to support themselves. And by giving them the means to and empowering them to build new businesses and build new innovations and work together and collaboratively, similar to the SheEO model, then that's going to be healing for them as well and give them the confidence to move forward.
Excellent. Thank you very much, Sarah.
Thank you.
We're now going to pass it over to Andrew Dillon. Andrew, you have the floor for 6 minutes.
Thank you, Madam Chair, and thank you to our witnesses for being here today. I'd like to start with Mrs. Bardswick. You spoke a little bit about the money that was given to shelters by our government. So we gave $10 million to Indigenous shelters and $30 million for shelters and sexual assault centers. If you could please, if you have some knowledge, let us know how this money was helpful during this pandemic, how it was used and how it can help promote further help to women in such situations of domestic violence.
Sure, and just a clarification that the $10 million given to Indigenous shelters was only given to on-reserve shelters, so it did not include urban Indigenous shelters or Inuit shelters. But the other money did go to those shelters that we distributed. So we've heard from different shelters saying that they were able to, offer their staff hero pay. They were able to hire additional staff or relief staff when their employees had to either quarantine for 2 weeks because they got back from a vacation in March, or because they were sick themselves, or they had to take care of a relative. They were able to purchase or to have hotel rooms and to pay for those hotel rooms. Sometimes they were given at a reduced rate, often they were not. They had to buy PPE, they had to buy masks, they had to sometimes change the way that their shelter was made up in order to have larger areas that women could go into, or to cutting off certain areas so that there was that level of social distancing. So the money has been a huge help, but it doesn't replace core funding.
Okay, and there's a high possible chance that there's going to be a second outbreak. And for you, what do you see as a priority for women's shelters? And when it comes to intimate partner violence, what are the priorities in that second wave, if there is one?
I think the priorities are around funding and around securing other means of housing women, whether that be hotel rooms, university campuses, anything else for the increased number of calls that are coming in. And we also do, as we've been saying, like we need a national action plan to ensure that things are equitable across the country, and that a woman in PEI can have the same high standard of care that a woman in Alberta could have.
Perfect. Thank you so much. My next question is for Mrs. Saunders. You explained and your business model, I found it very fascinating. You spoke that no businesses went down during the COVID peak, whereas in other places, some businesses very unfortunately just finished because of COVID. Can you tell us how you achieved this success and how this business model can be used to help other businesses?
Yeah, I mean, the thing that is unique about the approach that we're taking is it's all relationship based. So this is part of the thing. We are living in a world that's so transactional. It's like, here's my money, give me a return for my money. And it's all about accumulating that wealth and holding on to it as if there's not enough for everyone, which we know is crazy, because we're putting $10 to $30 million into assault centers, and we were just about to give $912 million to youth to volunteer. Like, oh my God, I just don't understand like how we decide these things. And so for me, this is such a no-brainer to get people in relationship with one another and to share the resources that we have to go towards the priorities that we have on this planet. I personally don't think we need to be investing any money in things that are not on the world's to-do list, which is our short form for the United Nations Sustainable Development Goals, things that create inclusive societies that take care of one another. We're just very out of balance in the masculine and feminine in the world. And so coming at this, when we look at the kinds of businesses that women select, they're selecting businesses that start at the very beginning, where there's no harassment in place, where there's flexible work, where we understand how women come to work and what they need in a different environment. So more models that are starting to design from that perspective will create much more connective tissue in society and much more resilient societies. It's more of the nurturing piece that's part of this, and we figured out how to scale it. So it's not like it's some loosey-goosey, women, blah, 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 it doesn't matter. It has like deep heft and scale attached to it.
Okay.
And minute left.
Is it done?
A minute.
Okay. Nope. You mentioned also about childcare. Can you please tell us specifically, because you said, if different women are at the table, can you tell us specifically what solutions can be had to resolve this issue of childcare?
There will be no recovery. There will be no recovery unless we figure out childcare. We're not going to have an economic recovery, and women will not be able to get back to work, and we're going to see disproportionate impact on women if we don't figure out how to pay for this or solve it. We've seen women told to keep their kids quiet when they're on a call, at home. Like, you have like 1-year-olds and 4-year-olds running around. Like, what do you mean keep them quiet? I'm in a 1-room apartment. Like, that's not a thing. And so figuring out how we can actually use some of the relief funds to be able to pay for childcare and have more flexibility around that for a business owner is absolutely critical. And then figuring out how we're going to safely open up childcare centers is obviously massively important before there's any recovery.
Excellent. Thank you very much. We're now going to turn the floor over to Andrian. Andrian, you have the floor for 6 minutes.
Thank you very much. I find that the three witnesses are great. So I'll start with Ms. Geiger Bardswish from Women's Shelters Canada. Now, clearly there's a link between an increase in violence against women and the pandemic, but is the social isolation of women, including sex workers, is it putting women more at risk? Is there an increased risk also of human trafficking? What's the link between and some women who don't necessarily declare their income have not applied for the CERB. So can you explain to us how in the pandemic sex workers have been penalized and how human trafficking might have increased as well?
So we don't work specifically on human trafficking. I do believe Amnesty International Canada just put out a brief about sex workers and receiving money not being accessible, not having CERB be accessible to them. So I would recommend looking at that brief. But I would not be surprised that social isolation made things more easier for women to be trafficked. And I know a previous witness mentioned about younger children being at home and being at increased risk of online luring as well. So I'm not surprised that would have an effect.
And to what extent should organizations like yours be supported by more consistent healthcare policies, for instance, housing and better accessibility for housing? If that was the case, do you think this would help women if there is a second wave?
Definitely help. One of the things we heard women were nervous about moving into shelters, into the communal space of shelters because of COVID and because of the virus. Shelters that were already set up to be apartment style units that were self-contained, they did not see the decrease in women coming to their shelter. They were at full capacity, if not more than full capacity. So that's something we've been advocating around the National Housing Strategy as well, that we need safe and affordable housing for women, because if there's not that housing, it creates a bottleneck effect in shelters where women cannot move out of shelter because there is no housing, and more women can't move into shelter. So it would be a huge benefit to have safe and affordable housing.
I'll continue with Ms. Saunders from SheEO. It's hard to promote health when women are drawn into politics, or sometimes women hesitate to climb the ranks. We've spoken to many women about that. So how can we help women climb the ranks of business?
If you mean climb the ranks within corporate structures, that's not an area I focus on. We're interested in funding women innovators and women entrepreneurs and helping them to thrive. And the way that we do that with SheEO is we fund them and support them on their own terms instead of trying to fix them to fit into the existing systems that we have. We are designing and creating new business models and new approaches to doing business that work on women's terms. And when you design from that perspective, you don't have any issues with people climbing. They're completely fine when they create their own rules. But when we get stuck having to fit into other people's rules, like, for example, you have to work from 9 to 5 and you have to, go pick up your kids at school, but you can't do that because the rules inside business are different. When you change those rules, women are fine. So there's no need to fix women to fit into these models. We need to change our systems so that they fit with women.
when we talk about changing the system, we know that the pandemic and telework, working from home, has shown employers that, this might be a good way of operating, and some female entrepreneurs might feel it's a good thing. But I think there should be boundaries because women might feel penalized if they're working from home because there are no boundaries. So what would you say about female entrepreneurs and working from home? How would it affect their role in the economy, and especially if we are to reopen the economy?
For the question. So we have a very interesting mix of young mothers and others on our team, and all of our ventures. We ask these questions all the time. There is no one answer for women. We are so diverse and different in our experiences and what we need. I think that finding ways, those who have support networks and elders to potentially support and take care of their children, it helps. But again, finding some way of supporting, opening up childcare so that women who have children can actually get to the work and create boundaries between work and home is going to be absolutely critical. So again, I think that's a very important point for this to work.
Andrea, you're right. Andrea, you have 10. There's probably not enough time for a full question and answer. Any final comment?
OK. Rapidement. Oui, rapidement.
Yes, quickly. I have a question about housing for Indigenous women. How could housing help them get through this crisis?
Is because I'm looking at the time frame, so your question was outside of that. What we can do is perhaps if you could give us, Sarah, if you could give us a very, very, very short answer. I'm just really trying to watch the clock here. Very short, Sarah, like 10 to 15 seconds, so we can move on to Lindsay.
Yeah. I mean, we need to see the challenges as an opportunity, right? So we have housing problems for Indigenous people generally across urban, rural, remote, isolated First Nation communities, but even in Toronto, housing is a major issue for all Indigenous peoples, but in particular for Indigenous women and gender diverse people.
Excellent.
And so investing in them is great.
Thank you so much. Sorry about having it. I'm just looking at the clock and we have to get everything going forward. So Lindsay, you have the floor now for 6 more minutes.
Yeah. I'd like to address my first question to Women's Shelters Canada. Imagine Canada, I'm sure you have heard of their report coming out. They have stated that the federal government is inconsistent in how they administer grants and contribution funding. Multi-year funding is often not available. Legitimate financial and administrative costs are excluded, and program evaluation is not covered, even though it may be required in an agreement. The net effect is that charities, nonprofits, and their donors are essentially subsidizing the federal government. You had specifically addressed, and I appreciated the continual voicing of the fact that core funding is desperately needed. Can you explain further how in the future that movement away from short-term project-based funding and into that core stable funding is going to help for a second wave or any sort of future crises that we may encounter?
Right. So we've seen that because of COVID and because of the social distancing requirements, fundraising has taken a huge hit for shelters. And as I said in my remarks, a lot of shelters, the majority of shelters rely on fundraising because the funding that they get from the government, usually from their provincial and territorial governments, are either, yes, project-based, or they don't, like they'll build a house, so they'll build new bedrooms, but they won't pay for the staffing of those shelters or for the support and crisis services that are needed. So that's where the fundraising has to come in. We've seen in our report last year that the majority of shelters do not have fundraisers on staff. So that means that executive directors are fundraising outside of their desks while also trying to deal with crisis situations and shoveling snow and everything else that happens that they have to often do. So if you didn't have the project-based funding and you had core funding, then there would be a lot more time to do the actual work that shelters are supposed to be doing.
And then to sort of build off of my colleagues from the Block's questions about housing. Obviously, we New Democrats have been pushing for a national affordable housing strategy for quite some time. The unfortunate downloading onto the provinces and municipalities has created a huge void in terms of what's required across Canada, both in urban centres for women trying to escape violence, Indigenous women and girls, certainly. I'd like to hear from both Women's Shelters Canada and the woman, Mrs. Wolf, about those challenges and the need for that focus in terms of a national housing strategy.
I think that absolutely, like a national housing strategy is something that I think would be very needed for Indigenous people, for Indigenous women and gender diverse people specifically. But there's lots of opportunities. We could be investing in innovation. And I think, again, if we're thinking about COVID and COVID recovery, I think looking at it from a big term perspective and not just the immediate crisis or the second wave, but also looking at it from how are we recovering from this downstream and starting to set the building stones now and investing in innovation, investing in long-term solutions. And as Vicky said, like resetting some of the narratives around how we can support and build each other up, how we can build relationships within communities and support each other to thrive in a post-COVID recovery context, and giving women and empowering Indigenous women in particular, but all women with the tools that they need to support themselves and to support each other is going to also help address some of the challenges around housing, around violence, around trafficking, around poverty, and around childcare. We need women to be empowered to make those decisions for themselves.
And I would add that it's not just housing for women, but it's housing for the shelters themselves. So second stage shelters, which are shelters that women need to go to if they have a high risk of lethality or of post-separation violence. They don't exist in a lot of rural and remote areas because there's no housing for second stage shelters to purchase in order to exist. So that's a huge issue as well.
And Chair, much time? Oh, wow. Excellent. Okay. So in terms of, if we move back into childcare, and it's interesting, I was actually on the Finance Committee when Ms. Saunders had her discussion about the necessity of childcare, and I was actually going to quote you and ask you to expand. So I'm so glad that you are sharing that again with us today. In the previous discussion, we had heard about the necessity for publicly funded, across the board, national standardization of childcare. So if you could continue to expand on, I know that we don't have women back in the economy without that childcare. And so the importance of that, I actually also heard today on the CBC, there was a quote from actually a witness coming in shortly, and she said that we won't just experience a recession in Canada without that necessary childcare in place, but it actually will be a depression because women will not be back in the workforce. So if you could expand on that.
Yeah, I hope she has some economic data to share. I am not an economist, so I don't have that. But this, I think we have such an opportunity with what's happening right now with the pandemic to look at what we value in society, to look at the impact of not valuing certain things, and to look at how we have prioritized growth over everything else instead of taking care of one another. And if you just look at what's happening in homes where elders are being taken care of or not, we continue to devalue taking care of one another. And these are like the building blocks of strong, resilient, incredible societies with great connective tissue. So I am so hopeful that we've literally have the curtain pulled back on all of the things that aren't working, sitting right in front of us every day, and we see the impact of what it does to society. So for me, this concept of valuing caring for each other, a caring economy, is going to have a huge impact if we focus on that going forward for Canada's resilience and our economic growth and support of Canadians. So for me, this is just such a no-brainer. On the Finance Committee, the person who chaired it said, we've been talking about this since 1980. You know?
Wonderful. Well, we've now ended up the panel for today. Thank you so much, Sarah, Vicki, and Caitlin. Thank you very much for bringing us your excellent testimony. We are going to suspend, go through checks for sound checks, and reconvene as soon as possible. So once again, thank you, and we'll reconvene very shortly. Suspended. We're going to convene our study once again on the impacts of COVID on women. We are starting our next panel, and I am very honored to welcome Lorraine Whitman, the president of the Native Women's Association, Jill Earthy, interim chief executive officer of Women's Enterprise Center, as well as Linda Gavsey, Senior Vice President, Universal Learning Institute. We're going to start off with Lorraine. Lorraine, you will have the floor for 10 minutes, and I will be cutting everybody off. Due to time, I will be giving you a 15-second, letting you know that I will be slowing it down. So we're going to start off with Lorraine. You have the floor for 10 minutes. Go ahead.
Well, Alan, good afternoon. Okay. Am I ready to go?
You are good to go, Lorraine.
Okay, thank you. Well, Alan, good afternoon. My name is Elder Lorraine Whitman, grandmother white sea turtle, and I would like to acknowledge the territory of Mi'kma'ki of the Innu Mi'kmaq people. I am also the president of Native Women Association of Canada, which means I represent and defend the rights of First Nation, Métis, and Inuit women across Canada. And
Lorraine, if you could just speak up just a tad, just a little bit, speak up just a little bit.
Okay, I'll get a little closer to the mic. You have all asked me here today to talk to you about the ways in which COVID-19 pandemic is affecting Indigenous women, and I appreciate the opportunity to share some of NWAC's findings and also our concerns. I am here today to talk about the pandemic, but I am also here today to talk about violence because of our communities, and the two issues are linked together. I don't need to tell you that COVID-19, when it hit the shores of the Indigenous women and their children, were among the most vulnerable population in Canada. I don't need to tell you that First Nations, Métis, and Inuit women and girls are murdered or go missing in numbers far greater than the proportion of the population. I don't need to tell you that the federal government has so far not delivered on its promise to create a national action plan to address the calls to justice of the national inquiry into murdered and missing Indigenous women and girls. The action plan would be a living document that is enhanced over time. It does not have to be perfect when it's first delivered. It just needs to be the start of the end of the violence which the inquiry labeled a genocide. Sadly, though, even COVID-19 increased the danger level for Indigenous women. The government has used the pandemic as an excuse for not releasing a plan. We are urging the members of this committee to pressure the government to listen to us and to keep its commitment. To listen to us and to keep its commitment. But let's look at the impacts the disease pandemic. As the pandemic threat grew, NWAC conducted a needs assessment with its provincial and territorial member associates. All but two responded, and the results painted a frightening picture. Our affiliate, the Nunavut Inuit Women's Association, for instance, said it was extremely concerned that levels of violence were on the rise as a result of the pandemic. Elsewhere in Canada, there were no medical resources on some First Nations to test people who appeared to symptomatic. Support services like community counseling and other programs were withdrawn, and the mechanisms established to help our people cope with their special needs disappeared. Between May 1st and May 29th, we conducted a survey of 750 Indigenous women and gender diverse people, a poll that was verified by Nano Research. The responses suggest that Indigenous women are far more worried about domestic violence than they were about the COVID pandemic crisis itself. That they are experiencing more violence since the pandemic began. That the most vulnerable are under the ages of 35 or living in the North. The romantic partners are seen as the most common source of the violence. And the financial impacts of the disease have increased the dangers. So yes, COVID is of significant concern to NWAC and the Indigenous Women of Canada. Among the recommendations that we made when submitting our advice to the government about the creation of a national action plan was a request for the Minister of Crown Indigenous Relations to host a virtual international best practice summit to discuss the impacts of COVID on Indigenous people in Canada and other countries, and to offer practical solutions. We have yet to hear back and are continuing to follow through with the Crown on these negotiations and talks. We note that in the document, The Impact of COVID-19 on Women, the United Nations says member nations should ensure women's equal representation in all COVID-19 response planning and decision-making. And in its document, The Impact of COVID-19 on Indigenous People, the UN says, among other things, that member nations should provide support to Indigenous communities that have imposed lockdowns or restrictions to prevent the spread of the disease. We are too asking for those supports. We are asking that governments reach out to Indigenous women who are under greater threats because of COVID and because of the financial hardships that have come with them. We are asking this committee to pressure the government to take seriously its commitments to end the violence that is taking so many of our women before their time. Violence that has become an even greater issue during the pandemic. Walalin, merci beaucoup. Thank you.
Thank you very, very much. We're now going to turn it over to Jill Earthy from the Women's Enterprise Center. You have your floor.
Thank you very much. Good afternoon. It's wonderful to be here. I'm here before you as the interim CEO of Women's Enterprise Center in BC, representing the interests of women entrepreneurs who play a critical role in the economic recovery of Canada. But before we discuss how women entrepreneurs have been impacted by COVID-19, it's important to understand the progress we've made to date. Women entrepreneurs account for 28% of all entrepreneurs in Canada, according to a 2019 BDC study. And prior to COVID-19, it was projected that advancing women's economic empowerment in Canada could add $150 billion in incremental GDP by 2026, with women's participation in entrepreneurship identified, of course, as a key strategy to achieve this. Entrepreneurship also provides pathways for addressing inequalities in labor force participation for immigrant women, Indigenous women, women in rural and remote communities, and women who require greater flexibility in their working structures. Yet, as an underrepresented group, Canadian women entrepreneurs must overcome several financial, systemic, and personal challenges. They earn on average 58% less than male entrepreneurs, access less than 3% of venture capital, receive 14% of loans, and own just 48 cents in equity for every dollar male founders own. And there are many reasons for these gaps, many of which you would be familiar with. But they're primarily because the systems that have been created are not designed to be inclusive for all and do not address the different needs of women entrepreneurs. So 25 years ago, Western Economic Diversification founded the Women's Enterprise Initiatives in each of the 4 Western provinces to address these gaps. And these organizations focus on 4 key areas, including offering loans up to $150,000, advisory services, skills development, and mentoring. And women entrepreneurs assisted by these women's enterprise initiatives have demonstrated more growth than unassisted firms in terms of employment and sales. They stay in business longer, and their labor productivity is higher. We know this holistic plan works, and the impact is significant. Since 1995, Women's Enterprise Center in BC, the organization that I'm here to represent, has provided over $72.8 million in direct and leveraged financing, created over $2.18 billion in economic activity just in the province of British Columbia, which has helped to create or maintain over 3,000 jobs. We can't lose this momentum. And of course, a key component of this success is collaboration. In 2010, the Women's Enterprise Organizations of Canada, or WEOC, just to add another acronym, was initiated to bring organizations from across Canada that support women entrepreneurs together, to share best practices and to advocate through a collective voice for women business owners. Then, as many of you know, in 2018, the Government of Canada launched the Women's Entrepreneurship Strategy with a goal to double the number of women-owned businesses by 2025 in Canada. And both Women's Enterprise Centre and WEOC were recipients of this funding. And we're seeing through this coordinated effort many encouraging shifts. So for example, women are improving their financial literacy and access to capital. Between 2007 and 2017, we saw this increase by 20%. More women are exporting. We've seen the share of women entrepreneurs exporting nearly double from 5.9% to 11.2%. These numbers, it's all relative. And nearly 40% of women business owners are engaging in at least one type of innovation and working to improve. We're seeing shifts in overall growth performance. And again, these results are due to increased awareness, consistent support, improved resources, and enhanced collaboration between organizations from coast to coast. But now we are hit with a new challenge in COVID-19. I stepped into this role at the end of March. Interesting timing, just as the impact of this pandemic was truly being realized. I have been familiar with the ecosystem. I served on the board of the Women's Enterprise Centre for 8 years. I've been active in the Canadian ecosystem for 20 years in various leadership roles. So I have seen a lot of different things. I'm also the co-founder and co-chair of We for She, an annual conference bringing together business leaders of all genders, along with the next generation of young women in grades 10 to 12 with a focus on the economic advancement of women. I also currently serve on the boards of Sustainable Development Technology Canada, the Forum for Women Entrepreneurs, and the Women's Enterprise Organizations of Canada. And I just share this to demonstrate, this ongoing commitment to advance gender equity, but of course with a specific focus on women entrepreneurs and creating new models. And it's an absolute honor to serve in my current role at this critical time. With the onset of the pandemic, many entrepreneurs had to close their businesses due to health regulations or lack of customers. And women entrepreneurs were especially hard hit, as they tend to be in service-related businesses such as retail, accommodation, tourism, and food services. Some were able to rapidly adapt to the changing environment, and many, of course, have shifted to working from home. In Canada, 24% of female small business owners have children under the age of 18. So, of course, the concern is that women are taking on additional household duties, including childcare, elder care, and that the gaps outlined earlier in my remarks may widen. Over the past 3 months, Women's Enterprise Centre has risen to the challenge, or should I say opportunity, to provide enhanced support to women entrepreneurs throughout the province of BC using our proven model. We've offered increased webinars and business advisory services, and we've seen a 39% increase in the number of one-to-one business advisory appointments and a 202% increase in training participants. And as a development lender, we're able to offer deferred loan payments and interest forgiveness, of which 90% of our loan clients accepted. We proactively work with our loan clients based on their specific circumstances, and as a result, our repayment rate over the years has been 94%. This is a model that works for women entrepreneurs and will be even more critical as we move forward. We help entrepreneurs to understand their options, create a solid plan for recovery, and currently are navigate the many government programs, including the Canada Emergency Business Account Loan of $40,000, of which only 50% of our loan clients qualify. And this is due to 3 main factors. First, business structure. We know that women entrepreneurs are more likely to be first-time business owners operating as solopreneurs or self-employed without employees. Second, loans. Many of these government relief programs are being offered as loans, which is challenging given the business structure I just described, which are typically characterized by a weaker balance sheet and are often unable to support additional debt. And third, risk. Women entrepreneurs are what I like to say risk astute, not risk adverse, but prefer different forms of support and advice. And due to inherent lack of role models, benefit from holistic one-on-one supports when accessing funding, as really women entrepreneurs want to understand and consider all impacts. And this is why programs offered by the Women's Enterprise Initiatives are so essential. This is a time of change and reimagination to create systems and models that are more inclusive and holistic. And as we recognize the longevity of this current period of staged recovery, we're continuing to be proactive by offering interest-only payments for the next 6 months to provide a much-needed cash runway and to relieve that financial stress and to enable business owners time to adapt and plan and be more proactive instead of reactive. Another example of a new model is a partnership launched last month between Women's Enterprise Centre and Vancity, one of Canada's largest credit unions based here in British Columbia. And in consultation with Women's Enterprise Centre, Vancity launched a new loan product specifically designed for women entrepreneurs, keeping in mind their unique needs. So the program combines Vancity's loan with Women's Enterprise Centre's services as wraparound support. We launched this at the end of June, and there has been a surge of applications, indicating that there are still gaps that exist. This is also significant, as less than 30% of women business owners surveyed last year felt that banks, credit unions, and government-funded lenders recognize and respond to their unique goals, wants, and needs. And we want to change this, one credit union and one financial institution at a time. Helping entrepreneurs to navigate all these programs and resources, as well as to adapt business models and manage cash flow while maintaining a positive mindset and juggling increased household duties have been the focus of our dedicated team. And we're seeing this with our colleagues across the country. So with that, we'd like to suggest the following recommendations for consideration. First, data collection. We know the importance of this. We'd like to request that financial institutions and investors build diversity and inclusion metrics into the key performance reporting metrics for all divisions and sections of their companies that work with and for women entrepreneurs. And that government applies a gender and diversity lens across economic development, research and innovation, and support for small businesses, including the COVID-19 recovery programs. For example, tracking the percentage of women entrepreneurs accessing the Canada Emergency Business Loans will provide valuable insight and identify key gaps. A second recommendation, which I know this committee has heard several times, is the national childcare policy. This will enable women to have personal space to focus on business growth during their childbearing years. And a short-term solution to consider is even a caregiver grant, offering a grant to women entrepreneurs who have taken on additional caregiving responsibilities, which has resulted in decreased productivity. This grant could be used to...
Sorry, Jill. I know you have a great... Oh, you're just wrapping up just because we have just a few seconds. Okay, thanks.
Okay. Also considering a matching grant or a micro grant initiative offering... unlocking new capital by offering tax incentives for private investors who invest with a gender and sustainability lens, and of course, continuing to deepen support for training and support across the country. As we rise out of this global crisis, women entrepreneurs represent a critical part of economic recovery. So let's ensure that women entrepreneurs are poised to thrive. Thank you.
Excellent and great job, especially in your first 3 months. I hope your 90 days I hope they're helping you out with those 90 days. If not, we'll write you a letter here saying, oh, she's awesome.
It has not been boring. Thank you very much.
Well, what a 90 days. We're now going to move it on to Linda Gavsey, who is with the Universal Learning Institute. Linda, you have the floor for 10.
Thank you. I'm honored to be a witness for this committee. I've been with Universal Learning Institute for 25 years in a variety of roles. As a woman, a senior citizen, a full-time employee in the private post-secondary education field, and severely hearing impaired, COVID-19 has had significant impact on my sense of security, well-being, as well as the same impact school-wide. The women at ULI are local and international students, administrative staff and team members, and teachers. The senior team at ULI is female. I, as senior vice president, have owned my own school in the past and understand the entrepreneurial needs of the workplace. Today, I will focus on the experience of our female constituency. With COVID-19, many women were losing their part-time jobs or having hours cut, losing social connections, and not always meeting the technology requirements of study or work from home. This led to an assortment of issues for the businesses and for the individual. The business lost expected, the business of ULI lost expected revenue, and the students and staff were challenged to be resilient with all the changes and concerns coming at them at once. Following are some of the insights from your guidelines. I'm in the unique position of having designed, managed, and experienced the difficult transitioning from face-to-face learning to online learning and move the entire school to work from home 100% as the school required to shelter at home as we navigated this pandemic together. The greatest obstacles for students and staff were technology skills, availability of appropriate equipment, and childcare responsibilities. It was a steep learning curve for employees as they were not hired to teach or work online, and for students who did not sign up for online courses. Classes and streaming was happening for students with or without the appropriate bandwidth, equipment, or resources. This proved to be a great emotional stressor to both students and teachers who struggled with technology, the use of new platforms, as well as the sudden loss of social interaction. For many women, working and studying from home created conflict and tension. For example, these classroom requirements were complicated, with children at home needing home computer for their own schooling, thus competing with working mom and caregiver for limited computer resources, all at the same time. Some places were crowded, housemates requesting use of space or equipment in an interruptive manner, and balancing both home dynamics and work-school requirements, plus the increase in domestic unpaid work, all led to additional obstacles to completion of programs. Unpaid care work has increased with children out of school and the heightened care needs of older persons, as well as domestic responsibilities. Those living with seniors were worried about spreading COVID-19 to their healthy loved ones. Those with children were worried about their cognitive and personal development if they did not have the stimulation these children needed. Add the loss of social interaction, and the formula for continued resilience is lessened, and the potential of frustration is heightened. The female international students seem to carry a significant level of burdens as their world and connections in Canada is small and their families separated. Many of our domestic and international stakeholders are single parents, have satellite partners, live in crowded housing, live alone, or in the case of international students improving themselves, their children and family in a home country with less success of containment of COVID-19 than Canada. We luckily in BC and Canada have many resources, and we were able to post and advertise to give the mental health information readily to all, create internal social and academic circles on Zoom and other social media sites that seem to assist in reducing some pressures, and most of all, connecting students and staff to each other and creating new communities. We had to address the needs of women whose power, or lack thereof, at home exasperated the challenge of studying with teacher who was driven by curriculum requirements, attendance needs to regulators, and a push to progress. Many students fell behind due to the distractions at home. This was a hard cost to schools, as extra tutorials as classes were needed to ensure success. An additional expense during a time of declining revenue based on very little new enrollment or withdrawals of expected enrollments. Not a great formula for a strong bottom line. Gratefully, some of the federal Canadian government programs such as CERB and CESB, rental assistance, wage subsidies, and other programs have been and are very effective for the life of the business, as well as the life of our female students who lost jobs, financial stability, social security, and support systems. An important additional support was the federal government IRCC adjustment to allow us to teach international students with student visas online, which allowed the female students freedom to continue in their path towards a credential, albeit a quickly changed methodology. It is noted this adjustment will hopefully be extended as needed to service locally and overseas students as the pandemic cycle continues. The value added to this policy is the opportunity to maintain revenue in an industry which, in education and at ULI, is a substantially female population in healthcare and in management. For Wave 2, the technology part could be easier with assistance with cost and process of having the right number of computers in the family or living situation and in the school, the right type of internet bandwidth for classroom streaming, computers, cameras, microphones. The Canadian government has been most generous in helping Canadians and students this summer that I anticipate will ease the burden of managing a household, as well as redirecting resources to equipment for family needs. Additional individual and business support for the technology would be most helpful to the reduction of stress and anxiety with the second wave. The economy, many students are returning to their part-time jobs. We now know the burden of financial pressures and social isolation can be handled and will be less frightening should there be a shutdown again. We all recognize the temporary nature a second time around. The challenge of working or studying from home for women is daunting. When the second wave arrives, although parts of the transition will be easier, in some ways it will be a bigger challenge as people suffer from pandemic fatigue. I see the government offering some credit relief programs, example tax breaks for equipment, as well as pandemic education to maintain the energy to stay safe at home. Reinforced education about social distancing, a mask, and appropriate pandemic behavior, including balancing staying on track with every aspect of the lives of women. A more level playing field between private and public post-secondary institutions is a policy aspect of the experience that could help our students stay on track, such as allows many students to come to Canada who qualify and choose the path of a vocational school. This includes a look at the postgraduate work permit and spousal and family visas to help encourage students who have study visas to complete their studies if their families have an opportunity to come to Canada as well. We just graduated a class of 8 caregivers and 35 postgraduate nurses, all of whom had a variety of personal challenges listed above. Most of the postgraduate nurses are currently still working either in their co-op position or as sponsored employees across Canada in the healthcare field. Their personal journeys and stories are yet to be told as they watch their home countries ravaged by COVID-19.
Linda, if we could just wrap it up, we've got to get on to questions.
I'm sorry, I didn't hear.
We need to get to questions, so if you just want to make a final comment so before we get to questions.
Okay, I will go down. We ask for, hold on, let me just roll down a little bit.
Okay. It's all good.
Okay, the reduction in the workforce is staggering, and we need to find a way to support our students who are in co-ops that need to be delayed and need to earn a living to pay their rent. So I thank you, the federal government, for giving us the support that they have so far, but we need more and our students need more. And I very much appreciate the time for this, and I will take questions.
Excellent. Thank you so much. We're going to now begin. What we're doing is we're going to be reducing the questions to 5 minutes. So we'll be going around 5, 5, 5, and 5 before we go on into our next panel. So Mark, sorry about that. You're going to have to revise that. So I'm going to start off with Jeg Zahoda for 5. Go ahead, Jeg.
Thank you, ladies, for your time and presentation and the work you're doing with women during these difficult times. So I'm going to go to Ms. Whitman. You touched on what you said in your opening comments when the government announced in May that they would not meet its June target for the release of an action plan based on the final report from the National Inquiry. What was your reaction on that? And governments need to be able to lead and take action during a crisis, especially if the crisis remains ongoing. You need to be able to handle it when you're in government. So I'm curious to hear your thoughts on that.
Thank you very much for the question. First of all, I would like to mention I was very disappointed and I was very hurtful, for the members of the family who had open their hearts and their wombs with the National Action Plan when they told their stories or testimony. of their loved ones. And that's where the hurt came, because it was the families that were there that they thought there was a hope that the government would be able to help them. They seen the light at the end of the rainbow. But when there was no action plan, they were disappointed. They lost faith in the government because they didn't follow through with an action plan when they said they would have one a year later. But in saying that, we're still working, with the families as best we can to be able to uplift them and let them know that, we're still working with our minister, our Crown, Honorable Carolyn Bennett, so that we can work through it. So that was difficult, but as well as with the violence that's occurring, if we had an action plan, I'm not saying it's going to end today, because it certainly isn't. There's a lot of history that goes back into it. But if we had just one sheet of paper and we had given our Crown some recommendations from a roundtable that we had with the with all of the PTMAs across Canada and into the territories, that the government would be able to use that just as a piece, just a beginning, a baseline, so that we would be able to start the works in progress.
Thank you. I'll move on to Ms. Earthy. We know that many women-led businesses, such as catering companies, hair and nail salons, tutoring services, and home healthcare services, been massively impacted by COVID-19. Many of these businesses use personal checking accounts and are ineligible for the Canada Emergency Business Account. Should the government allow for certain businesses who dedicate personal checking accounts for their businesses to apply for the CEBA?
Thank you for the question. Now, I should mention too, of course, there is the Regional Relief and Recovery Loan Fund as well, that and some of this has now been extended to sole proprietors. So that absolutely has helped. And stage 3 of the CEBA loan has helped with that. I think it is a consideration. I think it is a reality, certainly for women entrepreneurs, that they don't all incorporate and shouldn't necessarily need to. A big role of the Women's Enterprise Center and the Women's Enterprise Initiatives is to provide that education and support, and to ask those questions of the entrepreneurs to understand their goals, so we can guide them towards the right resources. But I do agree that it is offering using personal checking accounts is a reality and should be considered.
Okay. The next question is similar to what I just asked, but many small businesses are unable to access the Canada Emergency Commercial Rent Assistance Program as well, because their landlord refuses to apply for it. Is this challenge having a proportionate impact on women-led small businesses? Your thoughts?
Yeah, we don't have data to confirm this, but I can share an example of one of our loan clients. Just from today, we were having a conversation. She has a gym, so an indoor gym for children. She has 2 locations. One of her landlords at one location is working closely with her and helping her, and they are accessing this program, which is wonderful. The other one is not. And her monthly rent is very high, and she, of course, has no revenue to offset that. So there are still some gaps there. We would love to see a little bit more encouragement for landlords to access this program, because we are seeing it's not being taken advantage, or that's not the right language. We would like to see more landlords use that program to better support entrepreneurs. And we certainly are seeing many of our women entrepreneurs being challenged by that.
We're going to move over to Marks Ray. You've got 5.
Merci, Madame la Présidente. Puis merci.
Thank you, Madam Chair, and thank you to our witnesses for sharing their experiences and their views with us. This is a really important topic if we are to open up the economy again. We're still in the pandemic. So my first question is for Jill Earthy.
Entrepreneurs, I just want to share for the group and the committee, Cover Gals Workwear, Alicia Woods from Sudbury, Northern Ontario. She's done a lot of work with adapting clothing for women in the mining industry to start off, and now she's trying to get more in the oil sands, and now she's adapted a lot of the PPE equipment for women. So So encourage to look at CoverGal's workwear and all the the work that she's doing all across the country. Jill, you mentioned about the financing and it's really important. I know you mentioned about the RDAs, the Western Diversification, and the 2018 program that put dollars for developing women entrepreneurship. So I wanted to know, because Fold here, like BDC has been, I want to know your opinion on BDC, has been kind of, I would say, neglectful for rural, for women, for resource-based companies. They haven't really supported, so I want to get your sense on that. And then should the federal government, one, expand the women entrepreneurship that was set up in 2018 during this pandemic? Would that be an appropriate, because we're looking at recommendations here for the fall, should that be done? And also, you mentioned about many of the businesses that women-led could not access the current program, so the RDA's relief fund that was put in place just a few weeks to address this, do you think we should be expanding that in the fall?
Thank you. So I think I heard 3 questions there. So first of all, to answer your question around BDC, that is a complex question. I would say, though, my experience with Women's Enterprise Centre of BC, we do partner with BDC. For example, our loan program is up to $150,000, and we partner with BDC to add an additional $100,000. Are there gaps? Yes. Can there be improvements? Always. And that's a different conversation. Then with regards to the additional support and programs, so under the ecosystem funding, under the Women's Entrepreneurship Strategy and the ecosystem funding, there is absolutely an opportunity to enhance support there, both to offer the additional training and support, financial literacy and guidance that's so important along with the funding. I think that is really the key piece. It's not just the funding, it's the wraparound support that's so important. Now, we are optimistic that there will be additional funding coming soon. But there is, I think the other key piece I should just mention is that the organizations that are supporting women entrepreneurs right across the country are collaborating. We're connecting, we're looking at ways to leverage this funding and resources to share best practices. So the impact that any additional funding would be very significant.
Good. And you also mentioned about data collection. Would you be able to provide the committee with some more detailed report on specific items that you feel would be beneficial for Statistics Canada or other federal government departments to collect data?
Yes, so specifically, and again, I can just share an example. So the recent partnership with Vancity came out of a conversation that we were having internally about curiosity around what percentage of women entrepreneurs were accessing the CEBA fund, and that's the $40,000 loan fund. We had our intuition around that, and some of that has been addressed in this conversation. But when we approached a couple of financial institutions, they are not tracking that. So certainly, gender is one phase of business, type of business. Some of those things are being tracked, but we really do need to dive deeper into the demographics. And certainly you indicated to ensure support for rural entrepreneurs and rural communities. That's another critical piece. So I do have a list I'd be happy to share as a follow-on and we will be submitting a brief which will include the recommendations and more specifics.
And I have 30 seconds before the chair mentions anything. So thank you, Chair, for allowing me. The last question then, just again, Mrs. Earthy, can you just expand on the caregiver credit you talked about? Because it's really important for caregivers. So just expand on briefly, please.
Yeah, so as I indicated, so caregiver, of course, is for both children or other elder family members. I indicated the percentage, 24% of women entrepreneurs in Canada have children at home under the age of 18. That's a lot of additional juggling that has to occur. And we're seeing a number of women entrepreneurs having to make the choice to choose family over building their business and continuing to have that business grow and thrive. The caregiver grant would provide much needed support, either to bring in or use for child care support or elder care support, or to hire assistants in the business. So ultimately it would be flexible to offer some different options to increase productivity.
Excellent. Thank you very much. We're now going to move over to Andrian. You have 5 minutes.
Thank you very much. First of all, I'd like to ask some questions of Ms. Whitman. On June 3rd, it was the first anniversary of the report on murdered Aboriginal women and girls, and you have also already talked about your disappointment. What could have been done during this first year, and what could help to predict help that could be granted to Aboriginal families, perhaps because there will be a second wave?
First of all, I'd like to mention that, yes, if we did have, the National Action Plan, which was to be happening, there was 9 months that the government could have even reached out to our national organization. And we had submitted some suggestions, some comments, how we would be able to work together in with what's happening with the violence that's occurring with our women, as well as some of the 231 calls for justice. Another area we had mentioned about under the 7.1, the health and wellness. We are soon going to be opening a resiliency center. And this center, it's a lodge which is implemented by our elders to be able to do to be able to help our women who have had violence in the past or who are still in with violence, so that it'll be able to help them, with their work and their capacity. So just to be able to support resiliency centers that will be able to be in each of the provinces and territories, so that dollars are available, that we will be able to have this start and be able to start it in motion. We have one that will soon be opening in Quebec on the national. We have another one in New Brunswick that we have been funded for. We have another one in Nova Scotia, which they're working on, and another one in Saskatchewan. So if we could have the government support and dollars to be able to continue, this would certainly be a good step and a for our women. Well, Alan, thank you.
Oui, puis on a... You also talked about the issue of violence. We know that at the heart of what we need to do to help women who are victims of violence and Aboriginal women during the pandemic, there's that whole issue of how do we support women to get resources when they need them? Where can they get help during this pandemic? Because there are lots of resources that have disappeared, resources that existed and that have disappeared during the pandemic. How can we solve this?
First of all, we have to, on our NWAC, we do have, with this Resiliency Lodge, we do have 4 elders that are there on a 1-800 number that people are able to phone into. And just to know that there's someone else at the other end. And then the information as it comes in, we have a navigator who would be able to in turn take the information from the elder to give more support to the, to the women, the girls, or the gender diverse who call, so that they would be able to meet the resources in their area, so that they would be able to help, or if there's a shelter that they can go to, be able to submit and be able to help them in whichever. And just a voice at the other end of the line as to an answer machine gives, the heart and, opens up that relationship of the cultural component that we miss because of COVID and the isolation.
My next question goes to Jill Earthy. You mentioned it. It really takes adapted programs for entrepreneurs, for women entrepreneurs. So if we wanted to help further, we would need tax incentives that would be adapted. You talked about tax credits adapted to part-time work, and also the networking issue. If I wanted to make a synopsis of what you said, that is how we could actually help women entrepreneurs. Is that correct?
Yes, and I thank you for that. Yes, and I would also add it's the networking, it's the access to capital, and if absolutely, it's also the education and training and ongoing support. We see the success that we do through the holistic model of the Women's Enterprise Initiatives because we offer one-on-one business advisory support as well as peer support, as well as access to additional education and training as needed. So it's multifaceted, and it is all of those pieces that help the women entrepreneurs the most.
Excellent. Thank you very much. We're now going to move on to Lindsay. Lindsay, you have 5 minutes.
Thank you. My question will be for Ms. Whitman. So I too was incredibly disappointed in the delayed response to the MMIWG report. I think that action now on the 231 calls for justice is really key. Recently, the Women's Association published a report card on the government's follow-up to the final report. And in that report card, you gave a failing grade for the government's response, including in the delivering on the right to culture, right to health, right to security, and the right to justice. So could you please elaborate for this committee more on the specifics of that report card?
Thank you for the question. First of all, it's in the cultural component as we, defend and represent our First Nation, our Métis and Inuit, making sure that the cultural component is there, and so that they're in a comfort zone where they're able to get the help. And that's part of with the shelters as well. There's only a few Indigenous shelters across Canada. Therefore, many of our women will not go to a non-Indigenous shelter due to not knowing the people there, not knowing their culture, their history. So they would not attempt to go there. Although the shelters are certainly well endowed to be able to help the women, but it's not culturally component, for the Indigenous. And with the health component, we're noticing more of the violence. We're noticing more with the mental health. And with the COVID, we've noticed more of an increase because of the violence. The people, they're isolated. They're in the same home as the perpetrator, the abuser. So with this, they're unable to get that help that they need because of the offices being closed down, or they may be outside of the community. So there's a lot of gaps, even though there have been dollars that have been for off reserve. Some of those dollars haven't gone to the Indigenous women and their children. As far as the security, again, we just noticed, a day after the national inquiry of Chantel Moore in New Brunswick being shot by a police officer, 5 times, and the security. And I think there could have been better ways, but we could always say if this, if that. But I do know that if there were, a means that they have a track or a record of elders in the community, of different knowledge keepers, they would have been able to call upon, that would have been able to help the Indigenous lady, that may have been able to de-escalate some of the events. So if we are able to have that in the line of the security, and again with justice, we're seeing more of our women, a marginalized group of men and women that are in the prisons that shouldn't be there. Even with COVID, in order for them to be able to be protected, they were going into a cell that was, it was if you have done something bad, but they didn't do anything bad. It said it's for their protection, when in fact it wasn't. It again, demoralized the women because of the situation they were in. And we're supposed to be there to protect the women, but we were putting them in isolation cells. So with the justice, those were the part. So no, we haven't seen many improvements. We're working on them. And I'm hoping that, with partnership and continuing, we will be able to meet the needs of the vulnerable women, girls, and our gender diverse communities, which again helps our communities as a whole. Well, Alan, for the question. Merci beaucoup.
go 45 more seconds.
Oh, okay. I think that we're seeing a movement too into a lot of the Black Lives Matter and against anti-Black racism and anti-Indigenous racism and violence, a movement towards more of that mental health focus, housing supports, that sort of thing. So if you could talk briefly about that movement away from a focus on hardcore policing or recognizing that there is systemic racism within our police forces and how that impacts the Indigenous community and women as well.
Ms. Whitman, before you get started, super fast. We've got about 20 seconds because that was a 45-second question over.
Sorry.
Go for it. 20 seconds.
So did you still want me to answer that or no? Okay. Yes, there is racism and discrimination. We're noticing that. I have spoke to, Commissioner Lucky. We are working together and hoping that there will be some changes. We have given her recommendations. We also gave it to the media, and that is, to be able to have a camera on the police officers so that, in an investigation occurs and we know, from the footage, there's no missing gaps or guessing, pieces to the puzzle. Again, the cultural component that we have an elder that would be available or a database that they would be able to use in the area of a situation with people with, mental health. And as well as, the stop to kill, shoot to kill. So we are working.
Thank you. Thank you so much. And I know that was such an important answer too. So thank you very much. On behalf of the committee, I would really like to thank Lorraine, Jill, and Linda for coming today and providing us your briefings and answering the questions. We are going to suspend for a couple more minutes to let the next panel turn over, and we'll reconvene very, very shortly. Suspended for about 2. Okay, wonderful. Wonderful, and we're going to reconvene, and this is our final hour of today's witnesses that we're going to hear from. Who we have today studying on this study, we have Anita Khanna, who is the National Director of Public Policy and Government Relations for the United Way, Rhonda Barnett, President and COO, Abbott Manufacturing and Chair of Advanced Manufacturing's Economic Strategy Table, as well as Armin Yelazin, economist and Atkinson Fellow on the Future of Workers. So I would like to welcome you all, and you can tell me later how I'm supposed to properly announce your name. I appreciate that. But we're going to turn it over to Anita. Anita, you have the floor for 10 minutes.
Wonderful, thank you. I'd like to acknowledge that I'm speaking from the unceded territory of the Algonquin Anishinaabe Nation, and to thank the committee for the important opportunity to contribute to the study. I'm Anita Khanna, and I'm the National Director of Public Policy and Government Relations at United Way Centraide Canada. On behalf of the United Way Centraide Network, I'd like to thank the federal government, MPs, and civil servants for your critical and important work to support Canadians through this pandemic. I'd also like to recognize the service of essential workers on the front lines of this pandemic: cleaners, childcare workers, migrant workers, grocery store staff, nurses, PSWs, doctors, and staff in domestic violence and homelessness shelters. The United Way Centraide Network is second only to government in funding for vital community services focused on eliminating poverty and removing barriers to social inclusion for vulnerable people. Serving all regions of Canada, United Way Centraide supports over 3,400 community organizations and 5,600 programs, including direct funding of over $11 million for sexual and domestic violence services that reach 122,000 people annually. United Way Centraide Canada and our network has been on the front lines since this pandemic broke in Canada, and our work has been multifaceted. We're leading and supporting community action tables and making direct investments to support basic needs and life essentials, access to food and delivery for isolated families and seniors, support for homeless people, and support to sustain essential frontline community services. And we've also been active in providing advice to governments about the needs of community members and the charitable sector that so many are relying on now and will rely on in the future. We've also been brokering new partnerships and coordinating sector-wide responses like bulk purchasing and coordination of PPE and food. Collectively to date, our network has raised over $30 million to invest in local emergency community supports across the country. We are also very honored to be serving as a delivery partner for critical federal investments to address urgent needs arising from COVID. We are ensuring that funding from the New Horizons for Seniors program and a portion of the Emergency Community Support Fund are being deployed to community agencies serving people in extremely vulnerable circumstances. Our on-the-ground experience affirms that the pandemic has impacted women, children, seniors, Black, Indigenous, people of color, precarious workers, and people with disabilities, among others who are marginalized, the hardest. Women with intersecting identities, racialized, gender diverse, disabled, and those who are mothers are more likely to be precariously employed, to earn less in the labor market, or to work in risky conditions. PSWs, grocery store workers, they are at greater risk of infection due to the lack of PPE, travel to and from work on public transit. They also face potential exposure at work, on their way to work, and the risk of bringing the infection home. Whether a woman is managing her household, laid off, or performing essential duties, they are much more likely to be working around the clock, caregiving for elders and children, and this has only been amplified with daycares and schools closed. Women's heavy labor burden also involves going into stores to purchase food, homeschooling supplies, medication, and other essentials for their families, again, placing them at risk of infection. Social distancing and isolation has worsened gender-based violence. Women who are in abusive relationships are more at risk, while close living conditions, economic hardship, family stress, and other pressures make women even more vulnerable in situations that could become abusive. Many women feel no choice but to stay in these abusive households because of the risks of staying in shelters with close quarters and exposure to infection, and this has contributed to an increase in invisible homelessness in our country. With these concerning trends, we need to ensure COVID-19 does not move women's economic and social gains backwards. The threats to advancing gender equality, expanding workforce participation, and building Canada's economy are just too great. Our deployment of community funding across the country has highlighted that many social issues and inequalities have deepened and become even more complex due to the pandemic. We've seen the additional vulnerability of low-income families and high demand for food, mental health, support, and an increase in violence against women consistently. United Way Centraide has deployed funding to serve women. Through the New Horizons for Seniors program funding, over 930 programs received support, and 60% of those targeted women seniors. Through the Emergency Community Support Fund, United Way Centraides have so far supported 116 programs that serve women and girls as primary population, and another 280 serve women and girls as secondary populations. Over $3 million have been granted to support programming targeting women and girls so far, and funding processes are still very much underway. The federal government has implemented critical policies and programs to help Canadians keep safe. These include the CERB, funding for sexual assault and domestic violence programs, increasing funding for Reaching Home, and much more. This is work that should be commended. We can also improve upon the programs and implement crucial additional ones that will further support women. Key elements of preparing for the potential second wave, achieving the she-covery that Armine Yalnizyan has written about, and building Canada back better demands action on a national childcare program, as well as prioritization of access to affordable housing and reduced risk of homelessness, improving access to good jobs and building more income security, as well as a stronger charitable sector that is there to serve women and provide them with good, stable jobs. The pandemic has made it clear that our economy cannot function without childcare. It is time to act on a national childcare strategy that ensures affordable access to high-quality spaces. Women and their families cannot recover without investment in a reliable system of childcare that compensates its majority women workforce like the essential economic engine they truly are. COVID-19 has also shown us that action to end homelessness and enable access to safe, affordable housing needs to be further prioritized. With high numbers of women in poverty who have mental health challenges or who are in abusive situations struggling to find and maintain housing, systemic barriers are clearly at play. We urge the federal government to take accelerated action on ending homelessness, to bolster supports for homeless women and gender diverse people, and to appoint the federal housing advocate and counsel in accordance with federal right to housing legislation. The job losses due to COVID-19 have been significantly higher for women as the service, hospitality, and retail sectors have been hardest hit and heavily challenged to recover. This will in turn hurt our economy as women do spend much of their earnings in local community. A program of good, stable jobs paying livable wages needs to be prioritized, and women need to have access to PPE in these settings as well. And of course, childcare will be essential to them returning to work and bolstering our economy. This is also the case when it comes to income benefit programs that boost household incomes to ensure that no one is left behind if they are working or not. There's also essential for Canada to continue its work collectively on anti-racism and building relationships with people of color organizations. It's a key community solution to get us through the pandemic, to meet the needs of those who are most vulnerable. And it's something that everyone should be doing at this time and is more important than ever. We have to continue the work of truth and reconciliation and confronting anti-Black racism and sexism, or risk moving backwards on those fronts as well. Finally, I'll speak about not-for-profit and charitable sector stabilization. Action here is critical given how many women are served by and serve in our sector. They make up 75 to 80% of our workforce. As a funder of the community sector, United Way Centraide Canada knows that organizations working with women and children are under significant strain while working to ensure they continue to offer vital services. The pandemic has created additional costs to organizations who are having to rapidly alter their models to meet public health requirements on their own reduced capacity, especially at shelters. It's a huge concern out there around financial viability for these organizations, given the loss of key spring and summer fundraising events like golf tournaments, galas, and events that have had to be canceled. In the context of already limited core funding for women's organizations, COVID-19 is a threat to the existence of organizations that are focused on gender equity. There is an urgent need to ensure the charitable and not-for-profit sector and its workforce is stabilized. Without this, the sector cannot support community members during a second wave or beyond. Stabilizing this sector and building it back better will help promote gender equality. We have a highly feminized workforce, and we need to ensure that they can stay in the workforce, especially with variations in school and childcare programs across this country. We know that many staff across organizations are stressed. They have to deliver more services in different and more costly ways to people in more need than ever before. This leads to big concerns about the mental health of their staff and teams who are suffering. They're suffering vicarious trauma and exhaustion as they address the hunger, the violence, and the mental health needs within their communities. And so many staff are concerned about the financial viability of their organizations and how to continue their agency operations, even as they make tough choices and make layoffs. Thank you to the committee for the opportunity to speak on this important topic. As leaders in evidence-based investments for lasting social impact, our members are deeply committed to building strong, resilient communities in collaboration with local community members, all levels of government, business and labor partners, and our individual donors through COVID-19 and beyond.
Excellent, and thank you very much, Anita. We're now going to move over to Rhonda Barnett. Rhonda, you have the floor for 10 minutes.
Okay, thank you. I'm assuming you can hear me well.
Hear you perfectly, thank you.
Okay, thank you. Thank you for the time today. My name is Rhonda Barnett, and I'm the president and COO of Abbott Manufacturing in Peterborough, Ontario. Oh, just a second. I guess you can't see my video.
Oh, yeah, I was going to say your camera is off.
Sorry.
Okay. I see it now, Rhonda.
Sorry.
Welcome.
Okay, thank you. I have been on this computer on Zoom and Teams all day with the government. So again, I'm Rhonda Barnett, President and COO of Abbott Manufacturing in Peterborough. I was the first female chair in Canada's history of Canada's largest trade association, Canadian Manufacturers and Exporters, in 2016 through to 2018, and started with full support of the sector and the national board. I started Women in Manufacturing, which is what I want to talk to you about today. I've been selected to be one of the 9 Canadians working with Monique Leroux on the Economic Strategy Council to help government. It's an industry-led strategy to advise government on 9 critical sectors to grow the economy. So I've been on that meeting all day today with 3 ministers and constantly carrying the torch around gender equality and building a gender balanced economy and recovery as we go into this next phase. So I want to just talk to you a little bit about the background of what brought women in manufacturing forward, what the federal government's done and the difference we've made, and then the problems that COVID has caused, and then talking about that recovery and how we build out that gender balanced recovery. And manufacturing is a sector where the wage gap between men and women is very negligible, especially in entry jobs, and we're working very hard to shift that. So there's a real opportunity to engage more women in the sector and elevate them in the economy. So just to give you a bit of background, manufacturing, it's one of the three engines of the Canadian economy. Manufacturing, mining, and agriculture. We need to make things and grow things and develop things and add value to them to make money, and we build a service economy on that. So it's a very important sector in the Canadian economy. We represent 10% of employment, which is about 1.8 million jobs, and 10% of GDP, which is $620 billion in Canada. So for every direct job in manufacturing, there's up to 3 other jobs created in the economy. So great opportunity as we recover to build out this sector, engage more women, and have a more gender balanced economy. So manufacturing is vitally important to the economy, and women are vitally important to the success of the sector. So historically, employment numbers in manufacturing for women were grossly underrepresented. For the last 30 years, the dial hasn't changed. And on a gross number of jobs, we were looking at about 460,000 jobs out of the 1.8 million jobs that women held in the sector. And so when I came on in 2016, we wanted to make a difference. So we worked together with Minister Monsef and Women and Gender Equality to set up a program and move the dial. We wanted to, we needed the talent to grow our sector, and women were grossly underrepresented. So we put in a bunch of programs, and you can look at our website, womeninmanufacturing.ca. It's world class. I travel the world talking about what we're doing in Canada, and there's a lot of countries that are starting to learn from us. So we set these programs together. We received a grant of almost $500,000 over 3 years to put the program in place. We have things like free diversity toolkits, which apply to male-dominated industries. Some great tools there. Please go and see those. Tons of tools, programming. A year and a half through the program, we were really making a difference. We called this program We Can Do It. It's a modern day Rosie the Riveter. And our goal was to add 100,000 net new jobs for women in our sector over 5 years. So in 1.5 years, we added almost, and I'll check my numbers here, 55,000 net new jobs for women in the sector as of February from Stats Canada. We didn't even get a chance to celebrate that. We'd passed our halfway mark in just 1.5 years, and the share of jobs increased from 28% to 29.6% of total jobs in manufacturing were held by women. So it was a huge win for the sector, for women, and for Canada. And then March happened and COVID happened. So I want to talk to you about that. And I want to talk to you about this SHE session. And I was urged today on the council to give some strong data points. So that's what I'm here to do today, is give you the data to let you know just how bad it is and how much work we need to do to double down. We've got tools, and we've got a government and policies and people to engage women in the economy. And we have to double down and do more of that because of what's happened. So in April, manufacturing lost 300,000 jobs, just over 300,000 jobs compared to February. So women were 29% of the labor force, but they lost 38% of the jobs, whereas men who had held 70% of the jobs lost 62% of the jobs. So job losses for women were negatively disproportionate to their share of jobs in the sector. Even more concerning than that, the sector's rallying, which is good. There's recovery, there's rehiring going on. And in May, the sector recovered 79,100 jobs. The June data will be released, I think, this Friday. So both men and women saw some partial rebounding, obviously, through these numbers. But men were called back in much greater numbers. And I had our statistician do a deep dive on this because I want to share some of this with you. So women earned only 15% of the recovered jobs in the sector. So we lost more jobs and we're recovering less. The gap is widening. It's a serious problem. So men recovered 85% of the jobs. And when we looked at it, I'm going to break it down for you, but it was actually men who had children that were over the age of 18. So it was even men outside of the sector that got brought back in. So your points around childcare are well taken, and I have some other thoughts on that. So my hypothesis to this problem that I wanted to share with you today is that women have seen greater job losses and fewer recovered jobs, possibly on a voluntary basis. In our sector, women might have put their hands up because they had to, out of a direct need to care for children and aging parents. So I'm sure that's something you've been talking about all day. So to verify this, I looked at the multi-use microdata files, PUMF, and cross-tabulated age of youngest child in the home with the sex of the worker. So looking at gender of the worker and the kids that were the youngest kid in the homes, just to see, what impact did childcare have. So as expected, women in households whose youngest child was less than 6 years old or between 6 and 12 years old, which were the categories, those women suffered the biggest job losses, 33,000 job losses. Men in households with the youngest child less than 6, also significant job losses, 18,000 job losses. So in fact, both men and women of young school age or preschool children have suffered a lot of layoffs in our sector. And what we've heard is, many parents, especially women, were hanging on by a thread to maintain employment and care for their children. So it's been a very serious issue. And, we're predominantly production workers. We do have other avenues where people can work from home or work part shifts, et cetera. But, there's a very serious issue here. So again, the interesting statistic is that men in households whose youngest child was between 18 and 24 years old have seen their employment rise over the pandemic by 13%. So that category actually had increases, not decreases, in job levels in our sector. So that means when the sector went back to the labor market to add capacity in May, net new jobs were awarded to men, basically with adult children. Not a surprise. We needed labor. Those are the people that could be recalled from disrupted sectors. So the data does suggest that caring for children is a serious factor to consider as we look at plans to rebuild the economy through growth in jobs, especially I'm talking specifically in my own sector in manufacturing. So what are the next steps and recommendations from my seat? Manufacturing is absolutely a growth opportunity for the economy, and we were already in a plan to double the output of manufacturing, and we were desperate to find workers. So we're going to get back there, and we want to double down and work with the CME Women in Manufacturing programs. They were working. We had moved the dial. It was so exciting, but we gained 55,000 jobs, but we lost 100,000 jobs overnight. So we're way behind. Now we've got to double down and really re-engage women back into the economy. We need to ensure that we engage women in all sectors and in our sector to pre-pandemic levels. And that's a very serious issue.
Rhonda, we're just coming to the end of your remarks. If you want to take about 10 seconds, just give us your final comment so that we can move on to our next witness. Thank you.
Sure. So one of my suggestions would be to leverage, childcare is a big problem. So what about programs like WorkShare for an expanded queues? We need to give women tools to be engaged partially in the economy and maintain adherence to an employer so that we can get them through this part where childcare and the access to education is so uncertain. So I'm thinking in light of not having the time to deal with childcare just yet, we need other levers to get women partially back to work.
Excellent. Thank you so much, Rhonda. We're going to move on to our final witness of the day. And Armin, you can, if you wouldn't mind helping me, I am terrible at saying your last name. So if you wouldn't mind helping me, Armin. Armin is an economist with the Atkinson Fellow on the Future of Work. So Armin, you have the floor for 10 minutes.
Thank you very much, Chair. And thank you.
Your video's off as well. So if we could see your video's off right now.
Better?
That's perfect. Thank you so much.
Thank you very much, Chair, and thank you to everybody that has been spending all day listening to witnesses. I know it's hot, and I know that it's the middle of the summer, and I know that we're all really struggling. And I thank you very much for your time and the invitation to bear witness to this august committee, and I hope you can change the world because we need you to do that. A month ago, the Bank of Canada told us the worst could soon be over for the economy. Great news. Of course, the pace of rebound and getting back to so-called normal is far from certain. And for Canadian workers, recovery just can't come soon enough, as both Anita and Brenda have said. In April's labor force survey, StatsCan said more than a third, 36.7% of the potential labor force did not work or worked less than half of their usual hours. May, a month ago, showed we had more of a he-covery than a she-covery. That is, more men returning to work than women. On Friday, when the next labor force stats come out, let us hope that the stories we are all hearing don't translate to more women simply giving up and dropping out of the labor force because they just can't juggle everything and do childcare and homeschooling too. The trends are deeply problematic for households and for the potential of the economy. This isn't a feminist issue. This is a macroeconomic issue. That's because household spending accounted for over 56% of GDP before the pandemic struck. And it's been a growing driver of GDP for some time because we've been exporting less and businesses have been investing less, which leaves only the household sector and government actions to continue to help GDP grow. Well, okay, household purchasing power propels the Canadian economy. Women's incomes are critical to maintaining household purchasing power. Women have been asked to pull more weight over the last few decades, and by around a decade ago, we made up half the employed workforce. So women's incomes are really critical to maintaining household purchasing power. But we have a lot of women that were deemed non-essential during the shutdown, the majority of whom were women, who are going to find their way back to being rehired blocked because the limiting factor for women's return to work is childcare. And mathematically speaking, it is simply impossible for us to get to recovery, to regain GDP or the number of jobs without women coming back fully able to return to work. Simply put, sing it with me now. This is the smash summer hit of 2020. There will be no recovery without a she-covery, no she-covery without childcare. And let me be really clear. If we don't do this, we are actually voting to move towards economic depression, not a recession, but a prolonged contraction of GDP by policy design. You can't turn around to your colleagues in any of your parties and say you didn't know, because I just told you. And there is no way mathematically it can happen differently. The acceleration of shovel-ready infrastructure, sure, that'll help speed recovery. That's fantastic. But mathematically, you cannot get growth in primarily male-dominated jobs to offset the number of jobs lost by women. Furthermore, you can repair all the critical physical infrastructure you want, but if you're just standing by and doing nothing about the loss of critical social infrastructure, you are not doing your job. And that is exactly what we are poised to do. User fees for childcare represent the second biggest cost for young families, second only to housing expenditures. Many families who lost their incomes forfeited their spots in childcare facilities because of the high cost for simply holding on to something that they weren't using. Childcare costs will undoubtedly also rise because of the new requirements for physical distancing, dramatically increasing staff to child ratios, and adding new fixed costs for space, for PPE, for cleaning. We do not know what share of our ecosystem of childcare, which in Canada is operated through the public system, through the private not-for-profit and private for-profit providers. We don't know what share of that is going to shutter in the wake of the pandemic because we don't measure it. But in the United States, they've estimated that half of their ecosystem of childcare is at risk. In other words, 4.5 million spaces out of 9 million spaces are about to shutter. And that would cost $9.6 billion every month just to hang on to the capacity they have. And of course, the fewer the spaces, the less the ability for women to return to work even when they have a job. The irony, my friends, is that subsidized childcare literally pays for itself. A study by noted Quebec economist Pierre Fortin showed in 2008, for each $100 of daycare subsidy paid out by the Quebec government, the Quebec government generated a return of $104 for itself and a windfall of $43 for the federal government that didn't put in one thin dime. It literally paid for itself. And childcare can indeed play a threefold role in recovery, because beyond simply facilitating women's return to work and indeed being a source of employment, the decision to ensure childcare is affordable and high quality early learning accessible to all families, that is going to maximize the future of the next generation of Canadian children, who in turn will be asked to lift up people too old, too young, and too sick to work. And that would lower public spending and increase revenues for governments and society. It pays for itself in the short term and the long term. Now, we may choose not to act as the federal government or not, but we will reap what we sow. And the US data provocatively shows that a return on investment on spending on childcare, subsidized high quality early learning education for kids that are at risk, return between $4 and $8.75 on each dollar invested in that type of childcare. Not a warehouse to make sure mommy can go to work, but a system that is targeted to neighborhoods where kids are more at risk of entering school not learning ready and not being supported when they are in school to continue to learn. The impact also doesn't end with preschoolers. Canadian data, our own evaluation, shows that spending on pathways to education, which has been supported by both Liberal and Conservative governments but never made the norm, has resulted in a net benefit of over $2,000 for governments over and above what they spent per student in the program, and almost $5,500 for individual students. It's a winner. Why aren't we doing this? What is the resistance to this? We are literally leaving money on the table by not using the opportunity that we have right now to improve our social infrastructure. And by rolling out accelerated initiatives in our biggest cities first, which have the biggest concentrations of children and the highest concentrations of poverty, we could maximize our collective potential and our individual potential. Across society and per person, we could improve our future by investing in childcare. Getting everyone learning ready and learning supported as they age has to be a 21st century requirement because the population is aging. As a shrinking working age cohort is asked to do more for growing numbers of people who are too old, too young, and too sick to work, we can't afford to discount the skills development of anybody. This means the supply of high quality early learning childcare should not be left to market forces to decide what is our choice, but rather integrated with the public education system, because it is a public good that is undersupplied by markets chronically. I believe that given the circumstances, this requires a national approach and a federal role. And I get it that that's controversial. Why would you put the feds in charge of childcare or having any role in childcare when it falls constitutionally into the provincial jurisdiction? I got an answer for you. Because childcare is more costly to operate safely in the post-pandemic world, because provinces and cities are cash-strapped, because the federal government provides funding also for healthcare and post-secondary education and runs EI, and because even if we don't raise taxes to pay for it immediately due to the post-pandemic fiscal pressures, debt by the federal government is the least risky and the lowest cost of any debt held by any economic agent in society: households, businesses, municipalities, and provincial governments. We would be crazy not to do this, even if it required borrowing to do it. I would be remiss not to mention the number of recent immigrants and migrant workers who have been made sicker and even died because of the pandemic and inadequate provisions for safe reopening.
Armine, we have only about 20 seconds left for your comments, okay?
Okay, thank you. I will say in closing, the pandemic has revealed that the caring economy, healthcare, elder care, childcare is a vital underpinning to the essential economy. You need a plan. If you had 25% or half of your roads and bridges at risk of collapse, this government would have a plan to fix it. What's the plan for childcare? We know that this is as critical for infrastructure as for anything else, and it is an economic imperative, not a feminist imperative. Thank you very much for your time and your consideration, and I look forward to our conversation.
Excellent, and thank you so much. We're going to start off with our rounds of questioning with 5 minutes each, and we're going to start off with Raquel. Raquel, you have the floor for 5.
Thank you, Chair. I just want to say thank you for doing such an amazing job today. It was a long haul for everyone, and I think you did a really amazing job. So I have a few questions for Anita from United Way, specifically for the Manitoba context. Anita, I'm a member of Parliament from Manitoba. I'm just wondering how many, I believe you have over 5,000 communities United Way serves with 88 offices. How many employees total do you have, and how many in Manitoba specifically?
Okay, thank you for the question. So we serve over 5,000 communities. We fund over 3,400 community organizations and 5,600 vital community programs. We have 79 members, just to be clear on that as well, not 88. In terms of the specifics around our number of employees, I'm sorry I don't have that figure in front of me, but I'm happy to follow up with you.
Sure.
Can you hear me? Yeah. Okay.
Yeah, no, I can.
Yes.
No, that would be great. Actually, I'd really appreciate that. And I've been to the Manitoba or the Winnipeg office, and it's a lovely office, and the people there are just phenomenal. And in a former life, I got to take a tour, so I greatly appreciate the work that your organization does in Manitoba. I want to ask you about the government's Canada Emergency Support Fund of $350 million total given to several different large-scale charitable organizations in Canada. How much funding in total did United Way Canada receive from this fund?
So thank you for that question as well. I'll say that it's one that I anticipated, and given we're holding a contribution agreement with the federal government, it is actually theirs to disclose in terms of the figure of distribution. So I'm not able to disclose that figure.
Oh, that's no problem. I hope that they are forthcoming then with that. The reason I asked is because, as far as I'm aware, Manitoba has only received $2.6 million from this fund, which went to United Way Winnipeg. I think it was distributed through the Winnipeg Foundation. But my concern is Manitoba represents 3.5% of Canada's population, but this portion of funding from the Canada Emergency Support Fund is less than 1%. So I'm just wondering if you would consider all the funding that you may have got for your national organization, if you would consider perhaps moving the proportionate amount of funding to Manitoba so that we get proportionally what we need. So could you look into that and maybe commit to considering it?
I can answer that question more directly. Thank you. So actually, the portion of funding that we received from the Emergency Community Support Fund has been distributed provincially based on population, actually. So the proportional amount United Ways received in Manitoba would follow that same logic. It's the same across the country. So you mentioned both the community foundations, I believe, as well as United Way. So we have two separate pockets of money.
So how much in total has Manitoba received?
I don't know the answer to that question, unfortunately, given I don't know what the allocations were to the other intermediaries. But I know that our distribution through United Ways was based on two factors. So one was the population, and the second was the consideration of need. Right. So if there were highly rural communities where it's more difficult to meet needs, we would have topped up, in a sense, funding allocations so the money could make more of a difference. And we're fortunate in Manitoba that we have United Way of Winnipeg and other United Ways that are able to serve beyond their traditional catchment areas in order to get into some of the more vulnerable communities and more rural communities as well. But I'll say there was a high demand for funding from the Winnipeg office, as you might have heard.
Absolutely. Particularly with our senior population, I know United Way received the $9 million from the federal government to support vulnerable seniors. Do you know how much of that specifically came to Manitoba?
Again, it would have been proportional to population. If you know what, I should follow up with you. I can give you the
Yeah, if you
exact
could.
figures
An email
based
would be
upon
great.
that.
Just
That would be no problem.
encompassing what Manitoba's got. We often have to punch above our weight to get noticed on the federal stage. So just doing my due diligence on it. I do have one more question. United Way has a vast network in Canada with thousands of employees and a great reputation as a leader in the charitable sector. So I'm just curious, did the federal government approach United Way about administering the Canada Student Service Grant? Were you considered at all for that?
I'm not aware of anything related to that.
Okay, I'm just surprised given that you have such a great reputation and the capacity in your national network. But now that the We charity has pulled out, maybe they'll approach you. And that's all the time I have, I think. Thanks, Chair. Thank you very much, Anita.
Thank you. We're going to now move over to Selma. Selma, you have the floor for 5.
Thank you, Chair, for an amazing job today. Thank you to all the witnesses for your important input as we try to navigate through this pandemic. My first question is for Ms. Khanna. Thank you for all what you are doing at United Way. I represent the riding of Scarborough Centre, which is a home to many immigrant women, and I know the challenges which they face every day, and now with this pandemic, they have escalated for many of them. So have you worked to ensure that the unique challenges faced by the immigrant and women of color are recognized and addressed by the projects which your organizations has funded? And if you can provide some details about what those challenges are and what you have done through United Way to make sure those challenges are addressed.
Certainly, thank you. Thank you for the question. So, we're very, very happy to report that allocations in the Greater Toronto Area have been made through the Emergency Community Support Fund, and that there has been a really strong emphasis in the Greater Toronto Area as well as across the country on implementing decisions based on considerations of equity. So to ensure that diverse women, racialized communities, and other very vulnerable groups are receiving this money. And we've, worked really hard to go beyond our regular funding relationships to reach the most vulnerable. So far in our distribution of funding through our network, we've seen 50% of programs or agencies receiving money are not currently funded by the United Way network. So we've really, really branched out in order to ensure that no one is left behind. So in the Toronto area, maybe not in your riding particularly, there's certainly been support through the New Horizons for Seniors program, for example, to the Afghan Women's Organization. There's also been support for the Massey Center for Young Women, which also serves a lot of racialized and newcomer women, providing emergency mental health support for adolescent mothers and children as well, who are impacted by the pandemic and facing some of the issues that I mentioned earlier related to violence within the home, homelessness issues as well, and certainly, cultural barriers as well to postpartum and other supports as well. So certainly we've been on the ground in community making decisions at community tables that have been informed by the experience of diverse women as well as other equity seeking groups.
Thank you. My next question is for Ms. Barnett. For many of your employees, work from home isn't an option. So this question is for Rhonda Barnett. Are there any measures you are taking as an employer to address the childcare issue your employees are facing? Have you thought of assisting businesses to have their own daycare centers on the sites in your sector?
Yeah, so can you hear me?
Yes.
Sure, sorry. Thank you for the question.
We lost your face, so wonderful.
There we go. Okay, sorry. Thank you for the question. Yeah, so my specific facility is a smaller facility, and with that, I provide a lot of flexibility. I actually have 2 new dads in my organization that their families had babies in February, and so I immediately put them on work from home so they could support the added stress in the home. So smaller facilities can provide a lot of flexibility. A lot of large manufacturers are already involved in these programs. I know Toyota Canada and many other big manufacturers look at sponsored daycares right at the facility. But it's a real challenging issue for small and medium-sized enterprise to provide that. So the best we can do is provide flexibility, look at investing in digital tools, et cetera, to make jobs a little more flexible. So I have some people that come in a day or two a week, and they can do the bulk of what they need to do, maybe even off hours at home to accommodate the children that are in the home right now. And it's often a problem in our sector with both young men and women. Young families today really do struggle with childcare.
Going for
yeah, I'm sorry, we're down to 5. I'm sorry, I'm cutting you off so
Okay, no problem.
Thank you so much.
Thank
We're
you.
now going to move over to Andriane. You have 5.
Thank you very much. You're right. We had a wonderful day with lots of wonderful panelists. To finish things off, I'd like to start with Ms. Canna. We know that United Way was mandated by the federal government to manage several programs that were implemented by the government. Your organization is well known, you have good networks, but that's not the issue. Is there not a risk of disengagement on the part of the government who's giving you the work instead of financing adequately social services and health services by giving the money to the provinces? We know in Quebec, because we know that that sector is fatigued. There are lots of women that worked for community association and they have more work given the pandemic. Given that fatigue, given that exhaustion, do you feel that this community network that you help is ready for a second wave, or is everybody just too tired?
Thank you for the question and the concern about the health and the well-being of our nonprofit sector and the workers. I would say that, I think there's sort of 2 pieces I would pull apart there. So the first is the necessity to support the workers that we've talked about and our, the collective ability to respond to a second wave and beyond, and also to understand that we, collectively in our sector work creatively across different networks, as you mentioned, and sectors to work with the private sector, to work with municipal government and provincial governments, in addition to the federal government and other actors, in order to bolster and support communities. And that is why it has been so essential that we have been working at community tables in terms of making allocations, to seeing if one community or one organization is stretched or could not continue its service due to the lack of personal protective equipment, for example, or another challenge, that another one could step up to ensure that the populations that they intend to serve do not suffer due to the situation, right? The situation of difficulty in accessing PPE and maintaining service. So our focus has been on service continuity. It is not, and safety for the community in terms of our activities. And that has been something that we will continue to focus on and have seen real success in working across, as I mentioned, sectors and tables to get funding to where it's needed and where it can be used best to support community. I'll give an example from the Montreal area. Actually, it was quite astounding at the beginning and the outset of the pandemic that our Centre du Grand Montreal was approached, I believe, by local government to help with the procurement of PPE early in this crisis, given its strong connections to the private sector, the producers of PPE, to ensure that there could be equipment necessary to continue service, whether within food banks or whether in public health kind of operations. So really to say that our sector, like many, like parents, like mothers, like others, are, feel the stretch, but also step up and step into creative ways to get the job done.
Merci beaucoup. Mon autre question.
Thank you very much. My next question is to Armin. We know that the government has put into place some tax measures to help families, the Canadian allocation, for example, but these are not sufficient to give an equal opportunity to women. You've talked about the importance of daycare. We have good daycare in Quebec, and I hope that it will be taken into account when we talk about this issue nationally. Tell us what other measures could be implemented to make sure that this is a she recovery to help women truly.
Thank you. Excellent question. Can I just say almost everything else pales in comparison to making childcare an accessible, affordable, high-quality reality for every family across Canada. It's true that Quebec leads the country in its expansion of access to affordable childcare. But even Quebec, I think you will acknowledge, has some room to improve its early learning education. I think what the system did was help parents get back to work without necessarily investing in children in a way that could maximize their own potential. And to do this requires a very strong commitment to a national vision of extending early learning as part of the public education system.
Excellent.
Making it accessible to people across the country, just like we make school-age learning accessible, and making before and after classes also available. I'm sorry, am I being cut off? Sorry.
Yeah, it's okay. It's near the end of the day and I'm just rolling my fingers everywhere, but it's all good. You have great testimony. So we're just going to move over to our last 5 minutes for Lindsay. Lindsay, you have the floor for 5.
Thank you. Ms. Yalnizyan, so how important is it to establish legislation to enshrine the right of high-quality childcare by the federal government?
I don't know the answer to that. In some provinces, we have the right to education enshrined, like in Ontario, it is a human right for a child to be educated. I think we need a national strategy to safely reopen the schools and childcare centers. And we need to be really vigilant that in an era where it is possible that we will lose capacity, as they are warning in the United States, that the capacity we are left with are not primarily for-profits that have got deeper pockets. And that, we saw the omen was there with the long-term care facilities. So I think the legislative approach is an interesting one, but it doesn't change anything if you don't have any funding and no principles and no norms for which you wish to make this a reality for people. Maybe we do need a Canada Child Care Act like we have a Canada Health Care Act, and perhaps those principles should be enshrined. I haven't thought about it, so it's an excellent question.
Thank you. I'm just going to shift a little bit. I'd like for you to just talk briefly. Canada hasn't ratified the ILO's Domestic Workers Convention 189. Looking at unpaid work and the realities of the fact that women do the vast majority of that unpaid work. Would that be a key leadership role? What are other specific things that the Canadian government could do to recognize that work and start to pay for it?
Oh, geez, what a great question. And we've been wrestling with this. In December, we're going to have the 50th anniversary of the Status of Women Commission's report. And we've been talking about these issues for 50 years, along with childcare. So I don't have a quick answer for you. I think it's really problematic to pay people for what was unpaid work. We already have tax credits for caregivers. And I'm very nervous that women will settle for essentially a very small stipend to do unpaid work and set back women's equality by decades. That's my personal fear. But I also recognize that maybe I'm fetishizing paid work. I don't know, right? Like you're raising one of these unbelievably difficult needles to thread. So kudos to you. Is there something else that the federal government can do? you bet, one of the things the federal government can do is to actually walk what it's talking on 10 paid sick days. It's telling the provinces to do 10 paid sick days, but it itself in its own jurisdiction does not lead by example. So it could be doing that at, in its own jurisdiction, which is about 7% of the labor market. It would make a big difference to some people. And we need to regulate the gig economy more, because we know that that is going to bust open in the wake of COVID. We're going to have much more on-demand work, and it's an essentially unregulated sector of the labor market, and we need to kind of we need 21st century regulations to govern this work, which is not as gendered as you think. Sometimes when people think about the gig economy and they think about, Uber drivers as like, women are going to stay at home and do TaskRabbit and Mechanical Turk and stuff like that if they don't get childcare. More women are going to do this kind of work. It is unregulated. People earn less than the minimum wage. Sorry, too much time.
1 minute, 60 seconds. No, just 60 seconds.
So, Ms. Barnett, you mentioned that a lot of the workers are, you said, hanging on by a thread. So, in terms of what you've seen, and again, we go back to unpaid work, we go back to the stresses on parents, but women in particular, childcare, elder care. What are the long-term impacts of those workers that you have seen because of COVID recently?
Yeah, I think by hanging on by a thread, I've listened to lots of CEOs around the country trying to support the young women with young families, and the young men too. It's been a family problem. And, I think it will be very discouraging for these people on a go-forward basis, that they've been stretched so far that, they do give up on that dream of a two-income home or whatever that was for them, or being in the economy, elevated in the economy. So we need to fix this so that we don't stress people so far on what should be realistic, that feels like it's a dream that they can't fulfill.
Excellent. Thank you so much, Rhonda. On behalf of the committee, I would really like to thank Anita, Rhonda, and Armin. Is it Armin? Armin, for coming today. You have brought excellent testimony once again, and so thank you very much. And on behalf of the committee and as a chair, I am so grateful that everybody is here today. We have had excellent panels. Thank you to all of the staff who have been here to support us. You've done an excellent job. I'm looking at my Scott over there, and thank you so much. And of course, to both our clerk and to our analysts, thank you so much. And all of the interpreters, I know we've been here for a long time, and I'm looking at everybody. Thank you so much for being part of today. Time to wipe our brows and get to work, but we will be back tomorrow. We'll be commencing at 10:30, where we'll have both Minister Paltrow and Minister Monsef. So I'll see everybody at 10:30 tomorrow to convene. Today's committee meeting is adjourned. Thank you.